Good morning and welcome to UBMD Orthopedic and Sports Medicine Symposium 2020. My name is Scott Dempsey. I'm the Director of Athletic Training and Rehab here at UBMD OSM. I'm going to be your host today. I'm a little saddened that we can't meet in person and have breakfast and lunch together as we have in years past. As an athletic trainer, you know, we're all creatures of socialization and getting together, and I love seeing all of you and getting together and catching up on family and friends. But it's a crazy time, and technology allows us to get together and do some things and include more people from around the state. I just want to tell you that technology-wise, when I went to school, we didn't have computers. That's also being known as being old. So if there's any problems, we're going to defer to Allison, who is our marketing manager, and she is going to take care of any little glitches that I create throughout the day today. So thank you, Allison Camp, for everything you've done. We really appreciate it. If anybody has any questions, you know, feel free to direct them to me and I can get them to Allison. Just a couple of procedural things before we get started here. First of all, you'll see a question and answer button on your screen. Those questions are submitted to all the panelists who can respond either via text or live during the presentation. There'll also be 5 minutes at the end of each presentation for Q&A. Where we can organize and address the specific questions and kind of group them together. No question is silly. I'll start out by saying yes, I am wearing shorts and flip-flops today. I can get used to this type of meeting. So please ask as many questions as possible. The more interaction we get, the better off we're going to be. Number two, we'll be emailing surveys and quizzes at the conclusion of the symposium today. Please just respond to the survey and quiz, and we will then email you your certificate of attendance. We'll also email you PDFs of the presentations. There are a lot of links and phone numbers and different things that will be presented that will be useful to you in the future. Finally, in case of emergency, fire drills, or any other problems, please execute your emergency action plan as you've practiced in the past. No bunching at doorways, no slipping on the stairs, and no potty breaks. Okay, so with that out of the way, let me introduce Tony Serace. Tony got his BS from Canisius. He's almost as old as I am. He got his master's from East Stroudsburg State. He's the director of sports medicine and Summit rehabilitation manager at Niagara Falls Memorial Hospital. He's also the clinical education coordinator and assistant professor of athletic training at Damon College. So I have to unshare my screen. And Allison will turn it over to Tony. Tony, I think you need to unmute yourself. There you go.
Okay. Well, good morning. Welcome to another year of the symposium with UB Orthopedics. Thank you to Scott and Allison in inviting me back to do a talk to get us ready, hopefully, for the fall season. In regards to athletics coming back and being prepared for what we have in store in the future, which hopefully we're starting to get a little better picture of what things are starting to look like in regards to athletics in the high school, collegiate, and professional settings. I think things are starting to mold a little bit in regards to what sports we're going to have. Hopefully in the high school setting, we get a little better picture the upcoming week. But my job this morning will be to get you ready and prepare you with some distance-based learning instead of in-person and doing skill-based learning, which I really enjoy doing over the years that I've been able to do this subject matter with Sports Medicine Concepts, with Niagara Falls Memorial and Damon College. Nothing replaces in-person training in the management of potentially catastrophic injuries and the practice of your EAP. So what I go through this morning is really just a substitute until you get together with your sports medicine teams to really go over these skills, review your practice, review your management of these types of situations and scenarios in person. And I encourage everyone who has been off for a long period of time to do some extra practice and review those skills necessary to get everyone back on the same page in regards to management of these procedures and really review and practice those EAPs. Some things may have changed during your time off at your schools or at your facilities, depending where you're at and what settings. And I really encourage you to make sure you review your EAP effectively and thoroughly in your return to athletics during this time off. Okay. So my plan this morning is to review management of the potentially catastrophic injuries in athletics, really zero in on developing a good thorough EAP, keeping it somewhat general, but detailed enough that you can disperse that to other sports healthcare professionals to be effective, that if someone picks up your EAP, that they can definitely determine to what procedure needs to be followed depending on what scenario is happening to respond to. So my objectives this morning to carry you through this morning with my talk is to review the components of an effective emergency action plan, review the medical timeout, which is critical and crucial at this time, has really become a main focus in regards to the professional settings and collegiate settings. And we're improving in the high school settings in the medical timeout prior to events and practices to make sure that we are prepped and ready to go prior to these events starting. I'm looking to formalize the critical care triangle, review those bases, what that entails, what healthcare professionals or non-healthcare professionals that you may have to use to form your critical care triangle, review transfers and equipment use, get that dust and off that equipment and practice those skills and really hone in on what you're looking to do during your training sessions. Explain when equipment removal is appropriate. Promote the EMS transport relationship. Things have, I think, over the years, probably the last 4 or 5 years, have really improved, I think, in regards to the AT sports medicine relationship with EMS in response to these types of injuries on the field. I think the more practice, the more communication that we have with other sports healthcare professionals that respond to these injuries, the better off we are. And what is our role in education or educating the ER personnel? So I'm going to take it right from the beginning of the EAP and follow this presentation all the way through to the management of the injured patient in the emergency room and how that is managed and who would take care of that patient. What I would like is, if you have questions, you can put them into the chat and we can address those towards the end. We will also have hopefully time for some scenario-based topics as well to discuss, and that you'll be able to engage with me in the chat. So practice and experience really cannot substitute any other type of learning in regards to this subject matter and topic. I really encourage folks and myself on a regular basis to run through scenarios, practice skills, review with students, review with other healthcare professionals, so that you keep your skills sharp through time. And as we season and become seasoned veterans of athletic training, as Scott mentioned, as some are getting older, that the more practice we need. Also, getting our younger upcoming athletic trainers and maybe newer athletic trainers all on the same page in regards to what protocols are happening. Some students are learning new procedures and new skills that maybe we didn't learn when we were in athletic training school. Two pictures here. This is me about 15, 20 years ago in regards to practicing with EMS and making a safety video. On the right, we had the opportunity a couple weeks ago. I brought some students from my emergency response class at Damon College to SMC's new facility. Mike Sindoma built a nice facility in Avon, New York, and he's hosting on-site courses of training in his facility. So we were able to do some hands-on training with him and his staff at his facility, and did a full day of practice and getting those hands-on skills with the students, which was really optimal and beneficial for my students to gain that experience initially. So these were first-year cohort students that just began in the master's program at Damon, and this was their third class this summer, and we put them right into some high scenario type topics and got some hands-on skills experience. So it was very beneficial to do. So COVID-19 precautions, just in regards to your training for the upcoming year. I really encourage, once we can get back on a regular basis with our sports medicine teams and whoever that is, that you have zeroed in on who is going to be part of your team. It may change due to COVID. It may change due to different protocols and scenarios that you may have in regards to COVID precautions. I just ask and request, when performing your biannual training this year, please make sure to follow CDC guidelines with wearing masks and/or face shields and gloves. Notice I put biannual training. My high recommendation or strong recommendation is to make sure that you're doing biannual training with yourself, with staff, and your sports medicine team to really make sure that you're honing in on those skills and fresh throughout the athletic seasons. So when we get into emergency action planning, the EAP is a term that we've become used to over time, and is really becoming an important document for sports medicine teams, facilities, administrators, legal, that we have some sort of plan that we will follow when these types of situations occur or emergency catastrophic injuries may happen in athletics, that you have a written document plan that is approved by administration and your facility or university or school setting, that we really bring it in to a formal document, which may be more general, to make sure that you're covering all of the topics that could happen and may have to use for your emergency action plan. So really, the EAP, why is it important? It basically provides guidelines and templates for documentation of emergency action planning, helps us prepare individuals for a catastrophic situation within athletics. Really bring in our team of, whether it's your team physician, your sports medicine staff, your EMS groups, whether it's the same group that you work with for every game, or if it's the private sector and you're not sure who is responding to an injury, getting that EAP out to those groups and really making it public that this is how we follow these things in our setting. Top causes of sudden death in athletics. Why are we looking to have a strong EAP that we are concerned with in our emergency action plan in regards to cardiac issues, head injuries, heat stroke, exertional sickling, asthma, anaphylaxis, direct trauma, and lightning. These are the types of things that we need to be prepared for and have a strong emergency action plan and being able to respond to those types of situations. So our EAP review is really with your sports medicine team approach. It is not one person. It's not you standing on the sidelines waiting for something to happen. It's basically making sure you're forming your sports medicine team depending or based on the setting that you are in. Your EAP should be reviewed biannually at least with all athletic personnel along with CPR and AED training. I encourage reviewing skills when you do your EAP and you run through with EMS or with your other medical staff, run through CPR skills. Not necessarily have to doing a whole formal class, but putting those scenarios in with using CPR and AED, using AED drills within your emergency action plan, having coaches and your staff having to respond to an AED drill during a practice, at the beginning of a practice, during a walkthrough, having those types of moments that people have to respond to. The EAP helps ensure the best care is provided in the event of an emergency. If everyone is on the same page, that event will be run much smoother than if we have not practiced in time or we do not have an effective EAP. So key personnel that we really look to have as part of our emergency action plan. At the top, it's got to be athletic trainers. That main focus of that AT, forming that team, whatever setting you are involved with, could be in the high school, could be in the collegiate setting, whether it's the junior college, Division 3, 2, or 1, based on the number of staff that you may have, and really moving up into those settings and more staff possibly within the professional setting as well. What I've used over the years that has really been beneficial for key personnel is athletic training students. Ideal in the high school setting to have that extra set of hands to help. It's an excellent learning opportunity for the athletic training students and interns that you may have, and it actually becomes beneficial as part of your team that you look to that may be participating or making major participation within that response to that injury. Coaches in the high school setting or even the small college setting may be needed. In New York State, coaches are required to have first aid training and CPR and AED training. They may be beneficial. They may have to help you. If you're the sole AT at a high school football game, you have to have a plan for others to help you, because in management of these types of catastrophic injuries, you have to have help. This is not a one-person show. You have to have in mind in your emergency action plan who's going to assist, and which I'll talk about a little later is your critical care triangle, who's going to be the part of that. Parents may assist as well. It may come down to getting involved pre or post injury, but being part of situations, they may have to assist you depending on the scenario. Administrators become very, very important now in regards to having those emergency action plans as being as formal documents in what we do and how we respond. Okay? EMS, I stated in the beginning, EMS, I think the relationship with EMS has really improved over the years. I think at least in Western New York, I think it's improving across the state too, in New York State, that professionals from those settings really understand or getting to understand what athletic trainers do. And we are getting to understand what paramedics and EMTs do as well. I've had the opportunity to work closely with some EMS staff with sports medicine concepts over the summer, doing some NFL training, distance-based simulations, and I've learned quite a bit from that realm and professional aspect of EMS. Highly trained, highly skilled individuals that can help and really be there as part of the team to help you. Physicians. Having those physicians that really are on your side, willing to support and be there for you in that situation. If they're on the sidelines, then they're part of the sports medicine team. Whatever it is, if it's on the ice, court, or field, physicians that are named team physicians really need to be involved as part of the training as well. If you're having biannual EAP training, then your physicians should be involved as well. In the NFL, it's mandatory to have one outside company run a training session and then an in-house training session, and all medical staff must be present for both of those training sessions. So that encompasses athletic trainers, interns, students, physicians, EMS. All of those health professionals must be involved in EAP preparation. Emergency response. In the event of an emergency, EMS systems should be activated as quickly as possible and with accurate information to ensure appropriate medical personnel are dispatched. First responders need to be trained. Those folks may not have learned specific things that we learned in school in management of equipment, management of a face mask on a football player or a hockey player or a lacrosse player. Having that cross training with those professionals really helps, and they know that we are trained in that procedure, and then we know what they're trained at in that management of those procedures. Administering medications on the paramedic side, what do they do? Supraglottic airways, what are they performing, those skills? Okay, so really being honed in on what those skills that those folks are able to perform that you may need on the field ice or court, depending on the situation. And you can then, as the situation or scenario transitions based on first response as yourself or the athletic trainer, and it transitions to possibly EMS care or paramedic care with the use of medications, then you, as the AT, you may have to assist the paramedic in regards to administering medications or administering further care. So there is a transitioning phase from athletic training to EMS and possibly back to athletic training in equipment management in regards to spine boarding or not spine boarding, applying a cervical collar, putting them on the gurney, those types of things. So really being able to be part of that team and the response. Include EMS, administration, security, and other medical professionals that may be part of your response on the field, ice, or court in your biannual training. These medical professionals and staff should have the opportunity as well to review and practice your EAP. Much more beneficial to have those folks involved. They will be more comfortable when those actual events do happen. We know that they don't happen a lot, but we know in athletics the potential is high, especially in contact sports, that when we practice together as a team, things go smoother as a team. Everyone will be more comfortable in working with each other. Very important in emergency situations that everyone knows what their roles are in management of those emergency situations. Invite those folks, invite them, and I think you'll be surprised how appreciative they will be with including them as part of your training and really make them part of your sports medicine team. Things to be aware of in regards to your EAP components that I'll talk about this morning is really the addition of the red kit. If you do not have a red kit as an athletic trainer, I highly recommend it. The BLS red kit is one that I think is very important to have in regards to response to injuries on the field, ice, or court. These are just a list of those things that are important tools or supplies to have within your red kit. And you can take a look at those and run through those, but these are important things to have that you can respond to an injury appropriately prior to even EMS arriving, okay? I have found since I started using a separate red kit for these types of equipment and supplies, I have my regular standard kit and then an additional red kit that is easy for coaches, administrators, students to actually identify on the sideline that if I'm out responding to the injury and I'm at the head and I'm locked in at stabilizing someone's head and neck, then I can have the students respond, go get my red kit and run to the sideline, get the red kit and the AED and bring it out to me. It's an easy identifier, easy to see on the sidelines, and makes it easier for response time. In our EAP, we are really looking at the response of early defibrillation, are critical in the event of a cardiac emergency with a target goal of under 3 minutes from the time of collapse to the first shock. Therefore, clear, detailed, and practice EAPs are essential to keep this goal attainable when time is of the essence. One thing I have stressed in EAP reviews that I've done this summer in regards to AEDs is one thing that is nice to add in the emergency action plan is actually a map of where the AEDs are. So if you hand out your EAP to your students or interns or other staff that may not be too familiar with your facility at the beginning of a season, they know where those devices are and they can respond to them very quickly when they know the map is up to date and current, and the ability to respond if needed if they have to go get that AED. Okay, so an including portion of the EAP is a map, which is recommended in regards to being able to locate that AED quickly. The primary AED for your response to these types of emergency is basically some athletic trainers have a portable AED with them. Some coaches have a portable AED as well. We're looking to have the pads, the latex-free gloves, safety razor absorbent towel, and alcohol prep pads. Okay. All important parts of response with an AED. So the EAP should be active and distributed accordingly within your league, schedule of teams that are coming to your venues, sent to other ATs, coaches that will be visiting your facilities. One thing that is strongly recommended is that each venue has a specific EAP for it, whether it's the pool, whether it's the weight room, if you have a field house, if you have multiple fields, if you're off-site, if you have multiple off-site venues that your school may use, having specific EAPs for that venue is, I think, critical that your staff has and coaches have to be able to respond to those injuries. Things to make sure that you have part of in your EAP: facility address, location, contact information should be identified in the emergency action plan. Communication equipment. What types of equipment are you going to use? Are you going to use texting? Are you going to rely on good signals where you are in regards to texting in your cell phone? Or are you going to have a backup device or a backup plan as well? Possibly radios that you need in regards to response to other medical personnel during practice or games. Review of hand signals, including those in your EAP. What is your initial hand signal for all come if you need the rest of your sports medicine team to come out to response of a potential catastrophic injury on the field? Review of those during the medical timeout, which I'll talk about next. Making sure everyone is on the same page and understanding what those hand signals are. Your all come signal, your signal that you may use for someone to bring the cart out or possibly for your red kit. Those all should be reviewed and documented within your EAP. Maps of facilities, maps of your fields are, I think, critical within regards to emergency action plan. Documenting those procedures within your EAP, having thorough labeled maps within the emergency action plan are important for all to be able to understand and identify where those parts are. Preparation, I think, is essential in regards to emergency action planning. After the review, then we feel more prepared. If we've practiced, then we feel prepared. If we've practiced more and more and we've had biannual training, then we feel prepared. The more preparation you have, the more comfort level you'll have with your sports medicine team to be able to respond to these types of injuries. Education and training, reviewing new evidence-based practice of what skills are new today and that are being documented and researched. What things are changing? Are you putting those into practice and are you updating those in your EAP? Is a new transfer recommended? Is that the evidence-based practice for our profession? And are we willing and able to move that older procedure out and move new procedures into our EAP? And training on those. And making sure that our training, whether it's certifications in AED, CPR, making sure that our skills are sharp for education and training. Practicing the down athlete multiple times a year during the fall, winter, or spring, reviewing that with your team, with your students, your interns, and I highly recommend AED drills. This will really keep your staff and coaches sharp during those seasons. As you know, for example, the winter season, obviously in the high school, in a non-COVID year, the winter season is a long season from November usually till March. Things may become slack, may start to, you know, become a little lax in response, and we can put those types of drills to make sure that we are sharp throughout the season in regards to responding to those types of injuries. Maintenance of emergency equipment, making sure that are being checked, and you are documenting that in your EAP and in your procedural manuals for your facilities, that you're having annual check of your equipment and that we're in good working order. Your EAP documents should be reviewed and updated on a regular basis. There may be changes that come throughout the year. Staff leaves, phone numbers change. The map may have to be updated if an AED is removed or moved within a facility, an addition of a facility, or the deletion of a facility. Updating those and making sure that document is thorough. So the sports medicine team, in regards to emergency action planning, must work together as an efficient unit during an emergency in order to accomplish its objectives. The team concept is crucial. So let's talk a little bit about the medical timeout. I think is an important component that really has come to light over the last few years when the NFL made it mandatory that a medical timeout is completed prior to every game, that each sports medicine teams from each NFL team meets prior to a game. It's usually 60 minutes prior to the game that they must meet to review the EAPs, any concerns or questions. Referees are involved as well, and making sure that everyone is up to speed in response to injuries on the field, and reviewing those with EMS and where the rig is within the tunnel and those types of things. And that has pretty much trickled down into the collegiate setting and into the high school setting, is making sure that there is a review prior to an event, whether it's handing the EAP and reviewing the phone numbers and ability to contact medical staff if needed. And it's a time to communicate with the visiting team staff as well. There's nothing worse than at a game that I'll go to cover and I'll be the visiting AT and there's no communication prior to the event with the home AT or AD or referees that we are the designated medical staff to respond to those injuries. That really should happen immediately once you arrive at a game, and really including everyone that would be involved in response to an injury. Anyone who might be called on to help in a medical or emergency situation should be present at the meeting, such as EMS, personnel, athletic trainers, team physicians, coaches, athletic director, and security. I think security is key to include in these meetings, due to that they can help you or assist you if need be in management of an injury. They're important that they may have to escort you or help you out of a stadium or unlock gates or get you to certain vehicles that need to be accessible or clear a path for you to get to the ambulance. Security, I think, is crucial in making sure that time is saved in response to medical emergencies. The emergency action plan for a variety of catastrophic injuries, as well as designate a safe landing zone for air medical transport if feasible. This may happen in certain areas of New York State. There may be medical transport. That is always something to include. We may not think that may happen, But if you think of the types of situations that you may be involved with, that this is really something to include. Here in Western New York, we have Mercy Flight that responds to catastrophic injuries in motor vehicle accidents, in gorge rescues, sports-related injuries may not be up in their list, but it may be something that you may use, and it's always good to plan for. So the critical care triangle and the initial response. The abbreviation CCT is made up of healthcare professionals or other personnel that can assist in the evaluation process. The critical care triangle, I think, is critical in regards to responding to the initial injury when the head person responds to the head of the athlete and stabilization of the head and neck. These members are determined prior to the season, practice, and/or game as part of the medical timeout if needed. Who's going to respond with me out to the injury? So if I'm the head AT for that game, and I'm the A person in regards to the critical care triangle, who's the B person and who's the C person that's going to come out with me for management of this injury in response? These three individuals are very important in management of a critically injured athlete, and it's basically the ABC concept. So if you look at the critical care triangle, the A person is at the head, and B and C is usually on either side of the head athletic trainer at the head. And they are responsible to assist the person that is stabilizing the head at that time, and may be responsible for specific procedures or skills that the head AT may call out, because that person, remember, is once they lock in at stabilizing the head, then they are maintaining that activity the whole time during the management of this injury. So the B and the C person are really important people to help the head athletic trainer. So the progressive on-field neurological assessment, or the algorithm for the critical care triangle, the A person, the B person, and the C person would be involved in management of those injuries. And this is just basically the steps in which we're going through a full on-field evaluation of an athlete, from the mechanism of injury and all the way of standing up the athlete and escorting them off the field. This is a nice algorithm or a pathway that you can use in regards to your acute evaluation on the field of a potential catastrophic cervical spine injury. Going to the head, once you determine the mechanism of injury, and if the athlete has told you what has happened and has pain or complains of other signs and symptoms of a cervical spine injury, then the head AT would go to the head and assess if any loss of consciousness, or if the athlete was conscious and talking to them. And then basically following through those steps, we would go through a log roll if they were prone to get that athlete onto supine, appropriate procedure in regards to stabilizing the head, making them one unit, and log rolling them to their back so you can evaluate further to further the athlete. Palpating the C-spine, midline or lateral. What type of pain are they presenting with you? What is the pain rating? From 0 to 10, have the athlete, if they're conscious, being able to respond to questions as well. When I review this algorithm, I also pepper in concussion questions as well. If I'm ruling out a C-spine, you must rule out a head injury as well. So you can include concussion questions as well if needed in response to these types of injuries. Is the athlete experiencing any radicular symptoms, any paresthesia, anesthesia in their upper extremities, lower extremities? Doing an upper quarter and lower quarter screen. The B person and the C person can assist and help you with this. One thing I always tell folks is to make sure that when you do the upper quarter screen or the lower quarter screen, that the same person does both extremities, so that there's equal compensation or grading of those sensation or strength during the upper quarter and lower quarter screen. Things that we go through once the upper quarter and lower quarter screen are completed will include an isometric phase of the head that basically takes them into 3 planes of flexion, extension, lateral flexion, and then also rotation. And that is now a beginning component of, now we've followed all the way through their algorithm of the C-spine evaluation. And now we want to see if the athlete can actually do an isometric contraction to see a visible contraction of neck musculature. So sternocleidomastoid contraction, just a light isometric, and seeing if the athlete can tolerate that. Following the isometrics, we're looking for passive range of motion. This is when I have the athlete's head in my hands. I'm basically now taking the athlete through some small motions at the neck level into flexion, possibly extension, rotation, and lateral flexion as well. Then I'll have the athlete now do some active range of motion, move them on their own. So I'll basically move my hands slightly away from the helmet or the head at that time, and then have the athlete do those motions on their own. If everything is going well, you're checking through this whole evaluation, any apprehension from the athlete or yourself. If at any time during this evaluation, the athlete increases pain, symptoms increase, the evaluation is stopped, and then the athlete is returned to supine if you got them to sitting and restabilized, and your EAP is activated. Before I get an athlete up, I would have them sit up first, review active range of motion in the sitting position. I would include a compression test as well, light pressure, overpressure of the helmet or the head with both hands equal over the head, and seeing if that increases any pain or includes or causes any paresthesia, anesthesia of the upper extremities. I would stand up the athlete if I'm cleared through all of that screening. One thing I always tell people is when you stand an athlete up, make sure you hold on to them tightly so that they, in case they get dizzy or lose their balance and lose consciousness when they go to standing, that you hold on to them tight and then walk them off the field. I always like to assist them all the way to the sideline. So transfers. When we get to a point of now we went through our evaluation, and during that evaluation, we blew a fuse. So I start my evaluation, and the athlete has an increase of paresthesia and anesthesia in their upper extremities. Then I would stop the evaluation, activate my EAP, and then I would prepare the athlete for transport if necessary, and using different transfers. So different type of transfers that we have available in our toolbox in regards to moving an athlete from prone to supine or onto a backboard, if using a backboard, is the log roll pull, or with an interrupted or uninterrupted log roll. So interrupted would basically be if they're prone, I would start at the head, log roll them to perpendicular to one side of their body, and then I would repeat that procedure, that I would return, and then a second phase I would go from perpendicular to their back. So it's basically a 2-part log roll. That's one that I prefer, is a interrupted log roll. If I'm at the head, I can adjust if needed, or personnel can adjust it as needed when we get them up on one side. Uninterrupted can be completed. That's going from prone and all the way to supine in one motion. That can be completed. One thing I suggest is practicing that thoroughly and making sure that everyone is on the same page and knowing that is going to happen. A log roll push-pull, that is another possible transfer that you could use, that's having personnel on either side of the down athlete. And this is all directed by the person, the A person at the head, in regards to management of the log roll during that procedure. In this picture, we have a description of an 8-person lift. This is a popular transfer that I really like, that I use and have used on the field and in practice quite a bit. If you have enough people, And that's the key, is with your emergency action plan, making sure that you have that personnel available if needed to be able to perform this type of transfer. One thing with the 8-person lift, depending on the size of the athlete that you have, you may need more people. In the NFL, if you have a lineman who is 6'5", 320 pounds, you may need maybe a 10-person lift. It may be a 12-person lift, depending on how many folks you need to assist in that transfer. That all should be determined who's going to help in regards to this 8-person lift. So this could be made up of the head athletic trainer at the head, which would be number 1. 2 and 3 would be the critical care triangle members of B and C, or 2 or 3. And 4, 5, 6, and 7 would be other personnel that you would have that could be from EMS that have responded and now are going to assist you with an 8-person lift. And the 8-person is the one who is controlling the spine board if used in regards to transferring the athlete. Now, one thing in regards to spine boards, we obviously EMS has started or has phased out the use of spine boards in the private sector. Mainly, we may use a spine board as a transfer device, possibly from just the field to the gurney. I had a scenario last year that we did that in regards to, I had a football player that was prone. We log rolled him, we did equipment removal. This was in the end zone during a game. And the athlete had loss of consciousness, had come to on the field, had blown a fuse, and prepared the athlete on the field. One thing that we did do is, as soon as we removed the equipment, we applied a cervical collar. As soon as we did that, then we communicated, or I communicated with the paramedic or EMS team that arrived, and we chose to use a spine board to transfer the athlete. So this athlete had no equipment on, just the cervical collar. These are used just as a transfer device nowadays in regards to EMS. Scoop stretcher. Scoop stretcher does have a place in the transfer process, but is normally surface specific, such as ice and flooring. Not ideal to use with an equipment-laden athlete or on grass and turf. It is difficult to attach the 2 portions of the scoop stretcher under the athlete with the edges of the stretcher catching on the turf, but it does have a place. We've practiced this anecdotally and used the scoop stretcher on the ice during hockey on surface or on ice training, and the scoop stretcher really can be used as a nice device if you have an athlete that you have to get separated portions onto the ice and use to scoop underneath the athlete. One thing that in regards to spine boarding as well to be aware of is that if you have heard about the motorized spine board, the motorized spine board was proposed probably a few years ago, and kind of lost interest over the last few years, but now it's starting to make a comeback. I know it has been brought back into some field testing, and the motorized spine board may be used in higher level in the collegiate or in the professional setting. So stay tuned on that in regards to management of injuries as well, that the motorized spine board may be a tool of choice in regards to transferring an athlete from the field to a gurney. Okay. One other thing, spinal motion restriction. Things that we look to do in spinal motion restriction, key components, which implies that true spinal mobilization cannot be obtained even with the patient securely strapped to a spine board. So when I'm stabilizing someone's head and neck, it is important to know that with stabilization, you are not necessarily stabilizing the cervical spine, you're stabilizing the musculature or head and neck itself. So premise is to prevent further harm to a spinal cord or column injury, but we use the terminology spinal motion restriction. So preparing for transport. how does it look in regards to what are our goals once we are preparing an athlete and we are using a spine board? This is what it looks like in regards to the prep and getting ready to move that athlete from the field into the ambulance. Okay. Equipment removal. In regards to protective equipment, should be removed if it is a liability. So in the transportation or preparing for transport for the athlete, if the equipment is a liability, and I've always discussed this with other athletic trainers and other sports healthcare professionals whenever we've done any type of education, is that during the prepare for transport phase, in regards to management of the athlete, if the equipment is a liability, meaning that it is in your way or it is no longer an asset to you in regards to stabilizing the head and neck, then it may be appropriate to remove the equipment. Maintain the objectives of CAB, circulation, airway, and breathing. If the equipment is preventing CAB, then remove it, or it is a hindrance after shock is delivered. So if you've used an AED on an athlete and they're a football player, it may be necessary to remove the equipment once all of those procedures have been completed. If I've shocked an athlete, I've prepared the shoulder pads, I've cut the straps, I've cut the strings, I've removed the face mask, the t-shirt is cut, everything is now cut up, then the equipment is not beneficial to have there in place. So that may be a time for equipment removal, and that's why we practice it. That is one important phase that equipment removal may be needed. And once that is completed and equipment removal is done, then making sure that a cervical collar is applied immediately after the equipment is removed. In regards to equipment removal also, helmet removal. If your objectives are not being met. So if I have an athlete, a football player, who has a pulse and is not breathing, do I necessarily have to remove the shoulder pads at that time? I can start to prep the shoulder pads that if the athlete loses a pulse, then I would need to start compressions. But if the athlete has a pulse and is not breathing, then I may only have to remove the face mask initially to breathe for the athlete. Okay, so if I log roll an athlete from prone to supine, I have a gap between the helmet and the ground. I would pack and fill to fill that space, stabilize, and then have the critical care triangle prep the face mask to remove it and then start rescue breathing as soon as possible if the athlete was not breathing. Now, as I'll talk a little further down the road here, face mask removal, if during face mask removal and it's not feasible to do, you have failure of the tool or failure of the fasteners, then you may have to do helmet removal. So that's why we have to practice all of these skills and be prepared that if these types of things happen. Okay. Equipment removal should be performed by at least 2 to 4 rescuers depending on the chosen technique. Okay. During this phase, there's stabilization, and then there's maybe a transfer of stabilization from the head and neck, from the A person to the B person, and then back and forth, depending on how you transfer that stabilization back between rescuers. A rigid cervical collar, obviously, once equipment removal has happened, then a rigid cervical collar provides stabilization, should be applied at the earliest and most appropriate time possible. During pre-hospital procedures, once equipment is removed, depending on the situation. Rescuers should be able to recognize when it is not appropriate to remove equipment on the field of play and have a plan to best manage that patient. Okay, so during a game, if an athlete went into cardiac arrest, initial phases to start to work on that athlete Most EMS groups now will stay in play. Basically, they'll stay, work on that athlete until they feel that it is safe to move that athlete. If the athlete has a pulse and is breathing, but you've prepared for transport, then basically the EMS crew would want to remove that athlete, most likely the use of a spine board with a cart from the field to the side of the rig, and then equipment removal may happen at that point. Now, if a spine board is not used, your EMS group states we're not using a spine board, then you would do equipment removal, stabilize with a cervical collar, and then basically do a scoop you could use a mega mover or a spine board to transfer them from the ground to the gurney, okay? So rationale on that would be advances in equipment technology, equipment removal by individuals with highest level of training, and expedited access and chest access is prioritized. Face mask removal. Members of the sports medicine team should be skilled in face mask removal. Combo tool approach is still the approach chosen. Helmet and shoulder pad removal, being prepared and ready to go, and having those tools as part of your red kit are a key in regards to face mask removal or preparing the shoulder pads as well. You may use some of those tools also. Making sure that your power screwdriver is prepared, the battery is charged. Some people will lock it out into reverse to remove the hardware if there are screws that are holding the fasteners on the helmet. And making sure that you have the quick release tools and also a flat bit as well for different fasteners from different types of manufacturers. So a Rydell football helmet, you would probably use the quick release tool to remove those fasteners and a flat screwdriver to use for a quarter turn release on a shut helmet. So the screwdriver is an acceptable tool for face mask removal. There is a percentage that there was failure during some research in regards to face mask removal, that there could be failure of the screwdriver or of the hardware. So you must have a cutting tool immediately available should the screwdriver fail. So always having a backup device. So same concept as communication, that you can't just rely on cell phones based on service, that you must have some sort of backup plan. If you can't remove the fasteners with a power screwdriver, then you must cut through the fasteners themselves. Transport by EMS and ACLS preparation. Working with EMS in transporting the patient from the field, ice, or court, and be there to assist if needed with equipment removal if necessary. If patient deteriorates within the ambulance, you are there to assist in the rig or in the emergency room. So the athletic trainer EMS relationship has really grown in regards to assisting and being part of that process, that we are there if needed in regards to management of the equipment, and doing training as well with EMS and ER staff. So in the ER, what are we looking to do? Once the athlete is transported to the emergency room, whether it's a trauma 1 center, if it's a suspected cervical spine injury, the proper facility that is chosen that this athlete's going to go to, what's the procedure in getting that athlete into the emergency room and managed inside a trauma bay? Educating your ER personnel on management of equipment. Basically, we as athletic trainers have a responsibility to educate and or train those healthcare professionals that may not be knowledgeable or comfortable in management of equipment and may look to sports healthcare professionals for that training. And this is a perfect opportunity to promote athletic training, promote your sports medicine team, is to introduce yourselves to the emergency room staff, the ER docs, those responders that would be part of the response or management of that injury in the emergency room trauma bay, and make them part of the team and promote athletic training within the medical community. So it's a great opportunity to work with those other professionals. The AT may become a vital part of the team within the emergency room based on the need for equipment removal and assisting with transferring the patient and removing the equipment. Now, in some settings, this may not be feasible, that the AT may not be able to go to the emergency room. There may be settings there are opportunities that may happen. In the high school setting, most likely it's not going to happen. A coach may ride along with the athlete and then assist. So that's why it's important, even training coaches, that if the coach goes to the emergency room and the emergency room staff is not comfortable or knowledgeable in equipment removal, then the coach may assist in regards to management of that equipment as well. Also in the ER, the AT could be a liaison with the family and team if need be, being that communication, and then this will also depend on the setting that you work as well. Okay. So what I'd like to do next, just a disclosure also on there is I declare no conflict of interest or secondary gain from this presentation other than the joy of educating sports healthcare professionals. Okay, so one question in the chat. So this is not related to EAP, to emergency response. In Canada, all that have to work field events are required to have a first responder certification. Do you think it would be beneficial for us to get something like that here in the USA? It is called Sports Medical First Responder. I think that might be beneficial in regards to working as a medical professional and having an additional certification in regards to working with EMS. That may be something that might be beneficial for the athletic training community to at least explore and look into. So yes, that may be a beneficial process in the US to look into. Okay, so what I'd like to do is in the chat, I'm going to, is there any other questions that we could address first before I go into some scenarios?
Tony, it's Scott. Can you hear me?
Yeah, go ahead.
So in the question box, it says, what is your opinion on states that do not use spine boards as part of the rescue process? Do you believe that this is more dangerous?
I don't think it's more dangerous. I've actually done it a couple of times this past year. We did not use a spine board in actual transfer or keeping the athlete on a spine board. In New York State, obviously, EMS in the private sector are not using spine boards. So really the recommendation is to make sure that we are practicing those skills. So when EMS has arrived, probably in the last 2 or 3 times that I have done on-field management of an equipment-laden athlete, I have actually removed the equipment and then applied a cervical collar immediately. And we used the spine board as a transfer device, but then also we've done it as using a sheet to then scoop the athlete and then transfer them to the gurney that way. That is the protocol that EMS has chosen and trained in now, and that is the choice of the private sector. Now, when we go up into the higher levels, into Division I or the NFL, they have basically made their protocols and this is what they are going to do. If they still want to use the spine board, that is their choice, and they have practiced that with their sports medicine team. So I don't necessarily think it's more dangerous. I think as long as you've practiced it and have a plan in regards to transferring that athlete, it can be accomplished successfully.
There's a second question in the question box. Do you have any suggestions for EAP for virtual situations? Teams conditioning virtually?
It's a good question. As of our times now that we are instructing training sessions and practice sessions virtually, making sure that if you are not in contact with your teams or they are practicing or doing training, that they have some sort of plan, whether it's with their coach or whatever plan you have or setting, is making sure that you have a modified EAP for that type of activity.
That's perfect, man. That's all the questions that are posted right. Uh-oh, the one more just came in.
Okay.
Why in the medical profession don't we have universal hand signals? We should all have the same signals, so when I send a signal, everyone knows what I may need. That's
a great point. That's a great point, because I know every sports medicine team that I've worked with over the years, everyone has their own signal, right? The head athletic trainer or part of the critical care triangle, there may be a person at the each shoulder that may call for the all-come and what that signal is. I think that's an excellent point, actually, in regards to emergency action planning, that if we had standard signals for the major components of response, then that would be an ideal learning phase to making sure that we're all on the same page in response. So that's a great idea. I'd have to look into see what we'd need to do to be able to make that happen, whether it's in the high school setting by the New York State Public High School Athletic Association or the New York State Athletic Trainers Association task force or one of those. Those would be great suggestions to make, because it would make it easier to respond, especially in the high school level, that if we know that, say we go to a game and there's a new athletic trainer that I've never seen before, we know what those signals are already, and we can review them and everyone is on the same page. So I think that's a great idea.
Okay, that's all the questions they have for now, so continue on.
Okay.
We actually got just one more, sorry, through the chat. Someone asked, just to confirm, you can use an AED with equipment on?
Yes, you can. Yes, so if you prepare the shoulder pads, you'd have to cut through the jersey, prepare the shoulder pads. So I've always taught that if we are preparing the shoulder pads for the use of an AED, so I assess an athlete, they're not breathing, they do not have a pulse, I would prepare the shoulder pads first, begin compressions. You should begin compressions within 10 seconds. So remember, obviously in CPR, compressions are the critical component that we're looking to do. One personnel staff member begins compressions, the other person starts the AED and puts the pads in place. So preparing that equipment is key to get to compressions and then preparation of the AED quickly. So the preparation phase should be cutting the jersey in the T format, cutting the shoulder pad straps first so that you don't have a springboard effect or a rebound effect of the shoulder pads with cutting the strings. So cutting the straps first, the strings, lifting those shoulder pads, preparing the T-shirt, and then beginning compressions as fast as possible and preparing the AED. Okay. So what I'd like to do, I'd like to put a scenario into the chat box and get some feedback on how us as our attendees would respond to this type of scenario. I'm going to put it into the chat and hold on one second here. Okay, what I'm going to do is I'm going to send a scenario into the chat and then just like to try to get some discussion going in regards to scenarios.
Hey, Tony.
Yes.
What the participants can actually do is they should have an option, if you do want them to speak instead of maybe typing their answers, they can raise their hands. I'm pretty sure they have that option. And then I can allow them to speak if you'd like to do it that way instead.
Okay. So if we do that, we can give them, why don't we give them both options? So they can put it into the chat, or if you wish to speak your response, then you can do that as well. Allison can turn your, or if you raise your hand, then she can activate you to respond verbally.
Yep.
Okay. One other thing that came into the chat that I see with the use of an AED with equipment on, is there any place you recommend to review proper removal of equipment? Any resources? There's actually a YouTube channel from Sports Medicine Concepts that does a nice job in regards to review of equipment removal. Mike Sindoma has his weekly skull sessions as well, and has those skills reviews to practice or review those skills. So here's the first scenario. And let's see how our group would respond to this injury. So Allison, you can tell if someone raises their hand.
I should be able to, yes.
Hey, Tony.
Yeah.
It's a lot more fun when we get to sit in person and pick on somebody, you know? Like look in the audience and say, hey, Mike Kemke, how do you respond?
That's right. That's
Everybody's
right.
hiding behind their screens.
I'll put a little edger here on the.
And if you raise your hand, you won't come on video, by the way. It'll just be your voice.
Oh, here we go. There's some responses coming in. Okay, so we have activate the EAP and prepare for log roll. So the athlete is prone. Activate the EMS and start, okay? You have to log roll and remove the face mask to start, okay? So obviously in this scenario, it makes it a little more difficult with the athlete prone. We would obviously have to log roll this athlete as soon as possible and then start our EAP, call 911, prepare the shoulder pads. No, we would not have to prepare the shoulder pads. They have a pulse, but they're not breathing. So we would have to provide rescue breaths. So the key in this component would be to prepare the face mask. So monitoring vitals, after log rolling, stabilizing the head and neck and opening the airway. The athlete may be able to breathe. Perfect. So remember, in this scenario, if the athlete is unconscious, we have to assume cervical spine injury. The athlete has a pulse, but they are not breathing, then we have to breathe for the athlete. So we need to get to the airway. So remove the face mask. If I can't remove the face mask, then I need to be skilled and trained and able to remove just the helmet, pack and fill under the head, stabilize, and then breathe for the athlete. So one breath every 5 to 6 seconds using 2-person BVM, and breathe for the athlete Recommended dosage for the BVM is a half a squeeze or about 500 milliliters of air and just enough to see chest rise. So if we can breathe for the athlete, then we've already activated our EAP. We would basically, person that is sealing with the BVM would do a modified jaw thrust because we can't rule out C-spine. If we do a modified jaw thrust, then remember, possibly the athlete may start to breathe if we can move that tongue away from the airway. Okay, so you could try the modified jaw thrust first prior to doing bag valve mask, and then move along that way. If the athlete does not breathe, then you got to breathe for the athlete. Okay, good. I would want to log roll the player, remove the face mask after activating the EAP, clear the mouth guard from the airway while holding stabilization, BLS rescue breaths before ALS level of rescue breaths. Okay, good. All right, that's excellent, excellent feedback. Okay, let's try one more scenario. Okay, here's our next scenario for you to review. Okay, so obviously this would be a heat emergency. Remove the equipment, transfer the athlete into an ice bath to lower body temperature, have 911 on standby in case condition worsens. So one thing with that is a good thing to designate is a cool zone based on where you are in your setting. So in the high school setting, having an area designated during the hot days of the season during camp, that there's a designated area that you can transfer an athlete to that you have prepped and ready to cool an athlete if need be. Whether you're going to use the tank method when you're going to dip them, or if you're going to use the taco method, which could be another technique you could use in regards to cooling the athlete. But having that designated zone, having ice there, fluids covered under a tent so that the sun is blocked, those types of things, and having prepped to be able to make sure that that cool zone is ready in these types of emergencies. So activate the EAP, remove the athlete to a shaded area, remove the equipment, and start cooling that player while observing the patient's loss of consciousness and airway. Perfect. Must check rectal temperature. Excellent point. Gold standard in regards to heat protocol is that if we have accessibility to a rectal thermometer, is a Thermostor rectal thermometer would be an excellent choice to be able to get a very accurate body core temperature. Checking vitals, making sure that we are applying a BP cuff and pulse ox to start monitoring vitals right away as soon as possible. You can start that as soon as you, before you put them into the tank, or as soon as you get them into the tank to dip them, to monitor those vitals while they're cooling. I would want to remove his shoulder pads and helmet, get him somewhere cool, monitor his vitals, activate the EAP if signs and symptoms worsen. Perfect. Okay, so cooling that athlete, making sure that you're controlling the athlete with the rectal thermometer approach, making sure that you have the thermistor, that it's inserted at least 10 centimeters, to get an accurate body core temperature. One thing to remember with cooling that we've really stressed is that we are looking for a trend down to the temperature of 102. So if your initial temperature is at 106, 108, then you're looking to make sure you're trending down and cooling that athlete appropriately, applying fluids, administering fluids, and icing them as well on their head and neck while they're in the tank, okay? I would want to quickly assess the athlete and see if I could get to a shade, activate EAP, check temp via rectal thermometer, remove any equipment, begin cooling athlete, utilize the taco method to cool, monitor vitals, and transport once temp is at least 102 or below before transporting. Perfect. Cool before worrying about monitoring vitals. If they are not coherent, they are likely already at a high dangerous temp, above 104 degrees. Perfect. All right.
Tony,
Yes.
can you repeat the YouTube channel for sports?
Yeah. Okay. Alice, do we have time for one more scenario?
Yes.
Okay. Okay, we're going to do one last scenario before I finish up here. And let's see how your responses come here. All right, so this will be the last scenario of the morning for me. All excellent responses. Okay, so activating your EAP, the AT obviously responds to the athlete, checks vitals or checks CAB. If not intact, begin CPR. AED is brought to the athlete, and first shock hopefully is advised if needed. Okay. Activate EAP and make sure to get AED, log roll him over and start CPR and use AED when it arrives. Perfect. All great responses.
Tony, there was a question early on. It said, any thoughts on limiting key personnel with COVID and wanting to limit exposure? If you want to comment on that, that'd be great. I also sent a message to our HR and compliance attorney, kind of get their response on it, and so that we didn't lead anybody astray. But what are your thoughts?
Limiting personnel, obviously that's happening now in the NFL. They're limiting the number of people that are on the field and things like that during practice. But that critical team has to be there. Obviously in the NFL, that's a mandatory component that they have to have. But maybe it's limited to the fact that extra personnel that normally wouldn't be there aren't allowed near the event, and being able to restrict that, I guess, would be key in regards to COVID precautions and things like that. So I think that is something definitely to take into consideration, and also, with any of this right now, being able to manage these scenarios and follow the guidelines for COVID will be very difficult at times, I think, because if you're responding these types of injuries, you're wearing the face mask, you have gloves on, or if you have a face shield as well, you're working very close to other healthcare professionals or other staff. There's obviously that potential for exposure, but if you can limit, then I guess that is okay, but as long as you have the appropriate staff available, that would be key.
So I just received the response, and it says, currently there are no plans for limiting key personnel. Each office and department is running in order to maintain functionality and productivity while continuing to offer the highest level of patient care. We are committed as a group to follow social distancing guidelines and safe protocols in every location, patient-facing, and other procedures. We will continue to do this to maintain safe and healthy environment for our staff and patients. As we continue to open in New York State, it is important to follow protocols everywhere. The thought is potential exposure is literally everywhere: supermarket, gas stations, pet stores, etc. I could go on. We know that at our office locations, we maintain the guidelines at the highest level, and we are currently offering safer working environments than are running our weekend errands. So common sense goes a long way.
Yeah, yeah, basically that's the way it sounds. So
Does anybody have any other questions for Tony regarding emergency action plans, how we're supposed to remove equipment while maintaining social distancing, et cetera, et cetera. We'll leave it open for about 5 minutes here. If you have any questions, otherwise everybody can take a potty break real quick. And at 9:35, we'll move on to the next speaker. So if anybody has any questions, please pop them in now. Otherwise, you got a couple-minute potty break and we'll return. Allison, do you have the agenda and can you share that on the screen? Or would you rather that I tried to do it from my computer?
I can do it. I'll pull it up right now.
Thank you. Okay, so we'll move along here and move on to Nicole Rakowski, who is one of our athletic trainers here at UBMD Ortho. She did her undergraduate work at Canisius and then graduate work at University of Cincinnati. Nikki coordinates the athletic training coverage at Harbor Center for us. She also is the COVID coordinator. How she got that lucky job, I don't know, for Hamburg Lacrosse. But hopefully we get to put that on the past history soon here and move forward. So we'll turn it over to Nikki now. And if you have any questions, again, pop them into the question thread. Thanks a bunch.
Hey guys, all right, I'm just gonna pull up my presentation here. So I'm gonna talk to you about a little thing called COVID-19, and I'm sure you've all kind of heard about it by now. So right now it's really going to affect our return to work, and I just wanted to put out there our guidelines that are currently out there for colleges, secondary schools, primarily in New York. That's where I think most of you guys are from. So we'll get going here. All right, so our current New York State guidelines. This is what's allowed right now. All of you guys, I'm sure, are aware of all of this. And these are our regulations that we're following right now. Right now, these are the things that we're going to have to put in place when we return back to work. And we're going to be responsible for a lot of this and implementing that into our daily routines and EAPs, as Tony has touched base on. Okay, so right now, colleges and universities, the NCAA Board of Governors and the Sports Science Institute right now canceled Division II and III athletics for the fall. Division I actually has until today to determine if they're going to do the same. And that's really based on the majority of the conferences. If the majority of the conferences are teams are canceling, then that conference is going to cancel. All member schools obviously have to adhere to federal, state, and local guidelines. The NCAA actually started a tip line to allow parents, athletes, and others to report alleged failures to adherence to these guidelines. And so that's something new. And all student athletes must be allowed to opt out of participation due to concerns about contracting coronavirus. However, right now, their eligibility status and scholarships will be honored. Schools right now are not allowed to ask student athletes to waive any type of legal rights regarding contracting COVID-19 as a condition for playing. And they're all supposed to cover all the related medical expenses for these student athletes should they contract COVID-19. All fall championships and postseason contests must be conducted with enhanced safety protocols.
Hey, Nikki, your audio is breaking up a lot, and I'm not sure if it's your Wi-Fi connection or what's going on, but could you maybe try to exit and re-enter, or maybe stop screen sharing for a second and try to screen share again?
Try it again.
It may be your the fact that you're screen sharing and talking at the same time. So if you want, I can pull up your presentation for you if you want, and we can go through it that way and see if that makes it better.
I can't unmute. Can you hear me?
Yep, and it's actually a lot better. So I'll pull up
Okay.
the presentation for you and we can go through it that way.
Okay, that's fine.
Okay, and then just let me know when to switch the slides, but
Okay, did you hear any of it from before?
not really. I'd say we just start fresh.
I would start over, Nikki.
Okay, can you hear me now? Is that okay?
Yep,
Perfect.
it's a lot better.
All right, sorry about that, guys. So right now, these are the current New York State guidelines. We're in phase 4, and I'm sure all of you guys are up to date on what our current recommendations are. And that's what's going to be the most important thing in implementing that into our daily routines and our EAPs, as Tony kind of pointed out before. All right, go ahead. All right, so I was kind of going over this with our colleges and universities. Pretty much, they started a COVID-19 advisory panel to continue monitoring this pandemic. And I think that's going to be the biggest thing is if Division I does decide to go, because Division II and III have canceled their fall sports. If they do decide to go, things are probably going to change. And that's what that advisory panel is going to be doing. There is a tip line out there that will allow athletes and parents and others to report these alleged failures and adherence to current guidelines. As far as student athletes go, their scholarships and eligibility status will be updated. They shouldn't lose anything on that. Should they want to stick around, especially for some of these seniors, that might not be the best option for them. And it really just stinks all together. Schools right now cannot ask students to waive any legal rights about contracting COVID-19. Is that audio still muffled? I'm sorry about this, guys. Is that any better right now?
It's good right now.
It was working fine earlier. All right, Allison, you can go to the next slide. Okay, so as far as secondary schools in New York, the New York State Public High School Athletic Association and the Department of Health formed a COVID task force back in June. And they decided on postponing all fall sports until September 21st and canceled all the championships. However, we're still awaiting some guidelines from the state officials right now to determine if or when we can resume. And that might actually happen as early as next week. Governor Cuomo actually came out this week saying that he was going to make a decision next week. So what is our role in all of this? It's to know the guidelines and start to prepare. Okay, go ahead. So preparedness, it's something we're all very good at as athletic trainers. The NATA did put out a publication regarding return to sports after COVID-19, and that's broken down into 3 categories that I'll go over. Yep, the first one's just administrative concerns. No, you're going backwards. Okay. That's okay, you can stay there. So the first part is administrative concerns, and that's you need to ask to be a part of the COVID-19 response team. If you haven't touched base with your ADs, your principals, your school admin, any type of school physician, you probably should, just to see what they're doing right now. They are probably reviewing this communicable disease policy, and maybe you can suggest ways that you can suggest updates to that with regard to your standpoint. Oftentimes we are the only ones there after school or at away games or whatever. But the bigger thing is to collaborate with your school nurses and discuss these policies and develop this communication chain. So if something were to happen after school hours, you know who to contact in the event that you do have a COVID positive person. Obviously, our job always has been to promote wellness, safety, and hygiene amongst our staff and students, and that's including now personal protection, and collaborate with our ADs to adjust training conditioning protocols. Go ahead. So this is one other thing, our pre-participation physicals. We might want to follow mass gathering restrictions and stagger our start times. Some schools are allowing a current year extension. I know my kids' school is on their current physicals. This is to reduce the strain on primary care providers. So make sure you touch base with your school officials to see if this is in place, because it is going to affect your paperwork load coming up. And then obviously updated medical history might need to be adjusted on your paperwork, adding COVID-19 symptomology and exposure questions, primarily about pulmonary, respiratory, and cardiac systems. So kind of going along with the whole theme here is we should add a section focusing on mental health symptoms and disorders. There's been quite an uptick since the start of this pandemic, not in just the general population, but more so our athletes, without knowing how they're going to return to their sports. And so we'll get into that a lot later too. And then as usual, any new athletes or anyone with pre-existing conditions obviously should have updated physicals and clearances. Go ahead. Okay, so physical activity concerns. This is the other number 2 on our 3 categories from the NATA. We need to return our athletes and prepare them to full practices. So identifying and preparing deconditioning concerns and incorporating progressions to these full progressions is going to be, or full practices is going to be critical. So heat acclimatization is another thing. So now these kids have been out of sports for 4 or 5 months, sometime, and at some point it might be longer. How is that going to have an effect on their training and return to play, especially in the next point, if their seasons are condensed? We are going to have likelihood of shortened pre-seasons and the number of overall practices. So now you're taking these deconditioned athletes and throwing them back into practices and games where they haven't been in the best shape. So hopefully some of your coaches are already getting together and touching base with your athletes. I know at Hamburg Lacrosse we have been, but we're not allowed to actually coach our kids, but we do send out virtual workouts and such. As far as conditioning and practice concerns, you're gonna have to think about the COVID-19 guidelines here, especially because you may have to do signs and symptoms checks, temperature checks, health attestations. The kids might have to log in. Your school might have a virtual attestation that they might have to fill out. Your practices might be split if it's a very large team. So you got to think about the limitations and how that's going to affect going forward. Can you still hear me? I keep getting this message saying the speaker's not working. And as far as face coverings, to and from the practice field, and maybe even throughout some of the practices, depending on your location. And obviously, there's going to be enhanced cleaning requirements before and after the use of the field or court. Go ahead.
It is a little touchy again, but it was good for a while there.
Okay, so risk mitigation strategies. We've been doing this for years. We're obviously an integral part of this this process. So what we do is probably not unusual for us. So we need to prepare our facilities, the weight rooms, the athletic training rooms, our rehab equipment, etc. And make sure that we can enforce social distancing policies when applicable. As far as response to illness and reporting, we have to follow the school protocols. The simplest thing is to, if you're sick, stay home. Keep reiterating that to your athletes. And if someone does get sick during a game or a practice, you are to end that practice, quarantine that individual. So make sure you have a space kind of prepared for any type of positive individual or athlete that turns during a practice or game, and initiate the communication chain that I talked about earlier. As far as, typical promoting wellness and hygiene, you can do that just by sending out information to your staff and athletes and putting up signage within your athletic training room in school. And then, as Tony touched on, is review that EAP, know it like the back of your hand, and be prepared to move forward with that. Okay, go ahead. Okay, so considerations, we did discuss lowering the risk of transmission, communication and responses of confirmed cases, and preparation for return to play. The two things that I thought I wanted to touch on more in depth that came up in my research and discussions with colleagues was the increase of cardiac risks following COVID and the mental health concerns. Go ahead. So cardiac considerations, it's been shown that there's an increase of potential cardiac abnormalities following this COVID-19 virus, in particular myocarditis, that's inflammation of the heart wall's muscular layer, and that can cause severe damage to the heart muscle. So early on, this was only associated with hospitalized COVID-19 patients. And hopefully you guys can still hear me here. And the elderly, those with health problems. So now, in the last month, 2 weeks, young people are developing this injury. So in particular, chest pain, abnormal heartbeat, shortness of breath, and death. And prior to COVID, myocarditis represented 2 to 5% of all sudden death cases in American sports. And now with COVID-19, that is going to increase. So right now the recommendations are getting an EKG, an echo, and a troponin blood test to help with this injury. And those blood tests $50 and echo can run up to $100. I'm sorry, guys. Is that any better? I don't know why it's not working. It worked fine here yesterday. But the new schools have the money to cover these. I know colleges said that they were going to pick up the bill on these COVID-19 testing, and will they really? So one example of this myocarditis is that the Red Sox #1 left-handed pitcher, Eduardo Rodriguez, had COVID-19 with a myocarditis, and he's out the entire season. All right, go ahead, Allison. No, the other way. All right, so kind of transitioning into the rest of our presentation here is the mental health aspect of it. The NCAA did do a survey early on of the majority of student athletes that reported high rates of mental distress since the onset. So 1 in 3 reported sleep difficulties, more than a quarter feeling sad or a sense of loss, and 1 in 12 reported feeling so depressed it's difficult to function. And going back to the deconditioning thing I was talking about earlier, 80% admitted they were having a hard time keeping up with their training, whether it was because of their difficulty dealing with it or just having straight up access to their gyms that they were normally used to. So the AASP also published some tips for athletes, coaches, and the parents in the sport community, and their recommendations were to stay connected. Reach out to your athletes, coaches, staff, because everybody is experiencing some type of stress right now. Remain neutral, factual, don't go beyond what you know or offer your opinions. Recognize that the degrees of impact is going to be different for all of these athletes that you're dealing with, and continue to be a good resource for them. more importantly, and I think Meryl's going to touch base on this too, is to practice and model self-care and take care of yourself. You know, we are often the ones burning the candle at both ends and running around crazy trying to make sure everybody else is taken care of. And we have to think about that for ourselves. So our role in all of this is just to keep a watchful eye on our athletes and act swiftly to coordinate appropriate services. Go ahead. So this was a big stat for me, and 150 to 250% was the increase in rate of mental health concerns experienced in the past month among student athletes. And if this is happening at the collegiate level, you can bet that it might be even worse for our younger athletes. So this is a takeaway. Now more than ever, it's important to identify physically and mentally at-risk athletes. If you do nothing else after or during this pandemic, just be more aware and listen to them and have conversations with them. It's more important that you're acting swiftly now than you were prior to this pandemic. Lastly, the training rooms will wait for us, and so the best thing you can do is just be prepared going in, knowing your guidelines, and being ready to get back to work when we're allowed. All right, sorry about all the problems, you guys. I don't know what's going on out here in OP. That's all I have for now. If there's any questions, I'm happy to answer.
Very nice, Nicole. We're gonna have to tell the department to upgrade the Wi-Fi there at OP, make it a little stronger. If anybody has any questions, please put them into the question and answer thread. Even if they come up later on, we can put you directly in touch with Nikki. She's done a lot of research on the COVID and trying to keep us all safe as things evolve here. Any suggested resources for mental health aspect of sports due to COVID? Yeah, there's going to be a lot of resources coming up over the next couple hours, and we will be sending those out via PDF. And the question, can we get these PowerPoints emailed to us? Yes, you can get the PowerPoints emailed to you. As I stated in the opening, at the conclusion, we'll be sending out a questionnaire, survey, and a quiz. Once we get those back, we'll be sending PDFs of the presentations and the certificates of attendance. Is there a mental health survey available for use at high schools? We'll be talking about that a little bit later. So with that, let me click through a couple more screens here. Again, I'm kind of new to all this technology stuff. Let's move on to Meryl Cordelucci, who is again one of our athletic trainers here at UBMD Ortho. Meryl did her undergraduate and graduate work here at UB and is our supervising athletic trainer for the Buffalo Public Schools. And Meryl's going to kind of focus on us as providers, as being out in the community, and the things that we need to do to take care of ourselves. So with that, Meryl, where's your face?
Here.
Okay.
All right. So hi, I'm Meryl. I'm here today to talk about us and really any other healthcare provider and mental health. We are always taking care of everybody else. We are always there listening to everybody else and caring for everybody else, but who's caring for us? So we need to make sure that we are caring for our own selves and our own well-being. As athletic trainers, we are described by the NATA as healthcare professionals who work as part of a healthcare team, providing services of primary care, injury, illness prevention, wellness promotion, education, emergent care. We do examinations, clinical diagnoses, therapeutic interventions, rehab of injuries, and medical conditions. So our perceived images, as you can see here, we pretty much do all of these. We do nutrition and water for our teams, make sure that they're hydrating. We're getting them ready for games. We are taking them to doctor's appointments at the collegiate level, even sometimes at the high school level. We're doing therapy. In order to do all these things, though, we have to work a lot. We get little days off. We become emotionally invested in our teams. We are pretty much a team confidant at the time. So going into a little bit of mental health here, 46% of Americans will have a mental health condition in their lifetime. Half of these will be diagnosed by the age of 14. Of that, 1 in 5 American adults will have a mental health condition each year, which with all the pandemic going on right now, as Nikki spoke about a little bit earlier, those numbers are probably going to be going up a little bit more. So just because we are healthcare professionals doesn't mean that we get immunity to getting sick. We can still get sick. We can still develop these mental health problems. It doesn't discriminate. It affects everybody, all races, all communities. It affects everybody. So one of our big things is we have a lot of, I wouldn't say catastrophic events usually, but we do have a lot of crazy injuries and other things. And 82% of athletic trainers surveyed by the National Athletic Trainers Association, so they don't feel prepared to deal with the psychological impact of these major events that we have. And major events can be anywhere from a bad injury that could be season ending all the way to what we've seen in recent years, bus, planes, and plane wrecks. So we are going to talk about stress. Stress, how is brain and body respond to an external demand? They can be negative, it can be positive. Usually we think more about the negative effects of stress, which are decreased patient levels. We can have emotional problems. Sleep can get interrupted. When our sleep is interrupted, brains shut off, brain function can be altered. Cognitive levels are decreased, which decreases our capacity to perform these complex skills, which in our field, we don't want to decrease these because we are performing these complex skills daily. High stress levels and these long work hours that we have compared with a little bit of time off are going to cause us to burn out. Everyone reacts differently to stress, but at the end of the day, if this stress continues to build up and is not released in some way, shape, or form, then it's going to have this negative effect on our body. And if we have chronic stress and just let it keep building up, it's going to eventually cause some depression, some anxiety, health problems, cardiac problems, which we don't want. So burnout. There's 3 hallmarks to burnout. The first one is going to be mental, physical, and emotional exhaustion. This means that you're drained. You're not looking forward to work. Your body's tired. You're going to be sleeping all day. You have no patience to deal with anybody. You're just angry all the time. The second hallmark is going to be feeling frustrated. You're demotivated at work. You can't do anything right. You're questioning your skills, your knowledge. Is that really the right diagnosis? Which is going to make your athletes not respect you, think that you don't know what you're doing. Our third hallmark is going to be detachment to relationships and lack of productivity. You're going to be pessimistic. You're going to have negative outlooks on everything. On your life, your relationships, your home, and your work life will suffer. Burnout is the long hours, long periods of time, working under high pressure, pretty much our jobs. And so that's going to create this perfect storm for an increased risk of mental health disorders. We can't run on empty. So what causes this perfect storm? We're missing out on family events because we have to be at work all the time. Our family is going to get mad at us. They're going to start putting pressure on us to be places. We have long work days that a lot of times are increased because there's overtime that we can't predict. There is extra innings in games. Coaches sometimes just decide to increase practices at the last second. We have few days off, which then creates a constant cycle, missing out on family events, working the long days, pressure to be there. We have extensive travel. There's high levels of stress, pressure to perform. This pressure comes from all sides. It comes from our athletes. It comes from the athletes' parents. It comes from coaches. We need to get them back on the field sooner. And we're always expected to put others in front of ourselves. It doesn't matter if you're having a bad day, if you're tired. We're always expected to perform at the top level and always be the best that we can be. And we also have a lack of control over our schedule, which that alone can cause some anxiety and work overload with us. So how do we take care of this? How do we kind of prevent some of these things from happening? How do we prevent the mental disorders from occurring? We need to start by practicing what we preach. Working out is going to boost energy levels. It increases your brain function. It releases serotonin to increase happiness. And working out can be a variety of different things. If you like to work out, I'm sure there's gyms at most of your schools. If you're not really a workout person, try some yoga, some meditation. If you like to dance, try some Zumba classes. Are you angry from your coaches yelling at you all day? Try some kickboxing classes. YouTube has a lot of free programs that you can just log on to and work on. Some other ways to take care of ourselves. We can talk to people, spend time with family, friends, coworkers. I know that when I went through a little bout of burnout, just taking a walk with one of my friends and letting her talk about her problems and then I talk about my problems was one of the best things. If you don't like people and you don't want to deal with people, get a little fur animal, a dog, a cat, a hamster. Fur therapy is great as well. Establish a daily routine. It gives you control. Control what you can. Try not to worry about what you can't. You can't control those extra innings in the game. You can't control that overtime. You can't control that you might be late to an event. Focus on good things, not the bad things. Pick a good thing in every day. Is it your athlete said thank you today when they normally just walk away? Did your coach bring you some cookies? Did your child get a good grade in school? Find something good in every day. And smile. Smiling is contagious, and smiling actually has been shown to release endorphins, cortisol, which will decrease your blood pressure, increase energy, decrease pain, and it can boost immunity, which stress can decrease. Journal. If you don't want to talk to somebody, then get out that good old journal that everyone had as a kid and write stuff down. You just need to get it out. Good nutrition. For some fruit, something better. Vitamin B and vitamin C are shown to increase immunity, which decreases stress. Get enough sleep. We don't want to get angry. We don't want to turn into that Snickers commercial. This kind of goes along with the good nutrition where the guy goes crazy and then they get food or enough sleep and then they turn back into their normal selves. Establish activities to do outside of work. Don't make work your full-time thing. Join a sports team, start a book club. Take a walk. 30 minutes of walking a day has many great health benefits and can boost your mood. If you like kites, go fly a kite. find something that you can do outside of work. Schedule something to look forward to. Take a trip, schedule a trip to go visit a family member, a friend from college that you haven't seen that lives in a cool state that you haven't been to. Go to a concert, a spa day. Put something on your schedule so that you have something to look forward to doing, and that every time you look at your schedule, you can see it and be reminded that there's something there. Understand you are stressed. It's okay to say no. If you have too much on your plate, just say no, that you can't take on anything more. You don't need to be overwhelmed. And know where to find help and resources. One great resource to look at is AT Cares program. The NATA actually has a whole peer-to-peer support program that is geared just for athletic trainers and student athletic trainers who have been through any type of critical event. And it will help you navigate your way through your emotions. You can get some help if needed. It'll also help you work with your athletes. And it'll also train you how to be a better coworker. There is some psychological first aid training. It's found on the NATA website underneath the membership tab. You just go down to the members resource, and then it's the first thing listed there. There's two ways to get a hold of them. You can either email them, or there is an online contact form, and they will respond relatively quick. And there's also a list at the very bottom of the page where there's other excellent resources that you can go through. There's a crisis text line. Anywhere in the United States, you can text home to 741-741, and someone will contact you within 5 minutes. There's the National Suicide Prevention Hotline that we can use. There's also, we all have athletic training rooms and like to post things all over that would help our athletes. There are multiple PDFs that are found on this website for post-event self-care, stress management, mental health. They're colorful and would look great in an athletic training room. There's also the Mental Health of America website. That's about all I got. I just want to remind everybody that an empty tank will take you nowhere. So make sure that you're taking time to refuel, and it's not selfish to do what is best for you. Make sure that you take time to recharge your batteries. Any questions?
Okay, thanks, Meryl. We noticed that you can't talk without using your hands virtually as well as live and in person, but
A little Italian.
life is good. So if anybody has any questions for Meryl, again, please pop them into the question thread, and we'll be sending a copy of the PDF for her talk so that you can get the links. Okay, so with that, I want to start by, what do I got to do here? I've got to go to screen share. I kind of wanted to bring everybody up to date regarding how this whole process started. We start planning our symposium in like October, November, and at that time, you know, nobody even knew what COVID was or what the situation was going to be that we're currently working under or not working under. So just kind of to update everybody, we came up with this idea because New York State Public High School Athletic Association does an annual mental health awareness week. These are some slides from the 2019 event, and it's kind of where we got the idea to again look into how we can help our student athletes and colleagues So kind of mental health is invisible to us, but it touches all of us and is part of our life. This is a quote, part of that 2019 PowerPoint by the state from Kevin Love. You know, emotional mental health is like three-faceted. You know, it's our emotional, psychological, social well-being. It's a main determinant in how we handle stress and relate to others, and it fluctuates. It's treatable, it's changeable, it's malleable. Conditions that affect our mental health are biological, psychological, and environmental. You know, some of these things we can control and some of the things we can't control. On the right side, again, this is from the state's PowerPoint, are some of the leading causes of death in our athletic athletes demographic of ages, and you can kind of look through those there. Again, this is on the New York State Public High School website. The fact that 1 in 5 children ages 13 to 18 will have a serious mental health condition. It kind of breaks down disorders and how our athletes fall into different groups. There's different types of mental health. Again, the speakers coming up are gonna really get into some of these. You know, anxiety is a big factor now, ADHD, ADD, eating disorders. You know, the National Athletic Trainers Association has a whole portion dedicated to eating disorders and substance use, which is a big problem. Sports can be a factor for the cause of mental illness, but it can also be part of the solution. The impact of sports, you know, athletes can get depressed, although there's a lower rate compared to non-athletes. Athletes can become suicidal just as much as the normal population. However, you know, committing to their excellence, and you know, they're more likely to succeed. And again, Meryl talked about burnout for athletic trainers, but burnout for athletes who are playing the same sport 12 months a year, year in, year out, no rest, no time off. We see burnout to be a very common problem. This is just a screenshot of the New York State Public High School website. On the right-hand side there in the yellow circle, you'll see the link to their mental health toolkit and awareness week. This is something that I would encourage people to use. The 2020 presentation was done by students. It's available online, and you can just click on it and run it from your computer. So Michael Phelps has a website called talkspace.com. He has had some mental health issues in the past and has achieved great success in dealing with those. And I think that the big takeaway from his website is in this quote: and asking for help is not a sign of weakness. I hope that today we all gain some insight into how we can get help for people and how we can identify things. I'm really looking forward to the remainder of the day. I think Nikki and Anthony and Meryl did a great job getting us started. So with that, I think that we're pretty close to being on time. Stop screen share, Scott. So is Beth there? Yes, she is. So with that, I would like to introduce Dr. Elizabeth Botzer. Beth earned her BA from Bucknell, and her Piled High and Deep from UB in 2003. Among the hats that Beth currently wears is the school psychologist at Newfane High School, Newfane Central School. And while Beth was here at UB, she worked with athletics, where she assisted student athletes in life skills and academics. So with that, I'll turn it over to Beth. Thank you.
All right. I hope everyone can hear me. And I'm going to do the screen share now. I'd like to point out that I haven't been at UB in about almost 2 decades, so it's been a while. But I used to work with Kelly Piper, who's going to talk next. So I have lots of hats that I wear in my district, as well as a private practice that I also have, but I primarily do evaluations of students and inmates of Niagara County Jail, as well as veterans. So I do a little bit of everything, but I will say that I enjoy working in the schools the most, because you get kind of a whole, you know, there's never a dull moment in schools. So I have a lot to talk about today, and I'm going to try to keep things, I'm going to set my timer so I keep things rolling here. But if you have questions, feel free to reach out and let me know if you can't hear me, if there's something I'm not making sense with, feel free to reach out. So first off, the main topics I want to cover today are this. And again, I want to get into some details about different issues, but the main piece I want to get to towards the end is suicidal ideation and kind of how to deal with that crisis in your experiences, and just how to be yourself within an organization and not feel that there's no expectations that you're suddenly all becoming counselors. I know a lot of times you feel like it because of all the relationships you develop with kids, but in reality, you know, there's no expectation to be a counselor. When I do this presentation with teachers, and you know, I work with lots of different people within a school district, the cafeteria workers, the bus drivers, I'm talking everyone, I say you're part of a system. Okay, so that's the first thing after we talk about coronavirus. Real quick, my presentation would have been the same back in March as it is right now. The fact is, we're in the middle of a pandemic, so everyone's mental well-being, which is what Meryl talked about, it is at a whole heightened level that is a challenge for everyone. We have so many kids and so many athletes that don't have their same routine. And I know all of you have this plan that you're going to go back to work, and I know a lot of you are kind of in a holding pattern of, you know, what am I supposed to do? So know that a lot of this, what we're dealing with right now, is just trying to figure out how to cope with the experiences we're having. And I know if you're not, you know, if you're not going back to work right away, I want you to just hold on to everything I'm saying. The PDFs will be sent to you, and that way you can put it all into practice whenever you do get back into the swing of things. So your role within a school district. I love this. I hope you can see it without my picture over here on the side, but a school district has a lot of moving parts. There's, you know, the theater department, the social studies department, all these different departments that all feel that their, you know, what they have to offer is one of the most important things. So athletics is also another important part. The issue is the kids are all filing through all of these different departments. And you have to kind of recognize that even if you feel like you're on the periphery, and when you're working with students, you might not actually even go into the building very often. You might not know any teachers' names. You might not know who they're meeting with every day. When you're saying something to a student and you're saying this and you're expressing your concern about something, it might be the exact same thing that they just heard from their second period earth science teacher a few hours earlier. So recognizing that your relationship with students that you're developing and your role within a district is incredibly important. You actually have opportunities with students, sometimes more than what a teacher will have. A teacher generally, not in coronavirus time, but generally teachers have a lot more time, don't have a lot more time with students. There might be 20 kids in a room, whereas you might have 1 or 2 that you're working with and kind of interacting with on a daily basis. You might get to know kids a lot better than anyone else during their school day. So recognizing that you're part of a system, that it's important for you to kind of know who to funnel kids to, which direction to steer them when they start talking with you about any concerns that they're having. So let's get into that. So let's say in the world of mental health, it's not the same as physical health. Earlier, when I was listening to Tony Ceres talk about this, the EAPs, which I'm not an athletic trainer, so I don't know all the lingo, but you have a whole team. When someone gets hurt, there is a whole team that you kind of have a plan of action, exactly what to do, and you kind of all know generally. The world of mental health, it's not like that. There'll be a kid that'll say, I'm struggling with something, I'm feeling really overwhelmed, and how you reply and how somebody else might reply, it might take a long time from the fact of, yes, this kid does have an issue. Let's figure out how to get him some counseling. Let's figure out which counselor is available, because a lot of times there's simply not enough treatment providers out there. And then that the student is actually going to get along with that counselor and feel like this person's helpful. There's a lot of counselors, and not always, certainly I always tell students and I tell parents that going to a counselor is like trying on a pair of jeans. Any of you that have been through counseling, some people you kind of jive with, some people you don't. It's okay. Trying to find a good fit. So you have a kid, they express an issue, you try to get them into counseling, you have to find a counselor, you have to find one that they fit in with, and then that has to continue. That can take months and months. So recognizing there's a lot of barriers in the mental health world of figuring out how to help kids. And there's also, time constraints, to be perfectly honest. Just like you're all very busy, the athletes are busy. A lot of times the number one hours for counselors to work, out of district counselors, is like the 3 to 7 hour. And those, when I did private practice, those hours were so booked, I would be booked 8 weeks out to try to get in. So recognizing that to try to get someone help, to get a counselor might take some time. Nowadays, there's a lot of online, there's like betterhelp.com, there's tons of advertisements for that, but that is not the same as one-on-one counseling in person. But if it's the only thing that's available, then you can always recommend it, or have parents kind of seek that out. A big piece about students is the fact that if they're 18 or younger, or 17 and younger, they don't get to just decide to go to counseling. They have to have a parent that says, yeah, that's a great idea. And some parents just don't feel comfortable with that. So you're facing that. You have to get, parents involved and want the same thing that others might see as important. One of the big questions I often have from people outside of schools is what are the school counselors doing? How come they can't? Why are they not meeting with all? They are meeting with lots of different people every day. You have school counselors, you have social workers, and every district has different individuals that they work with. But they are generally putting out a lot of fires every day. You have a kid that comes in that's, lost his home and is living in his car with his, 2 siblings, and you're trying to get them a place to live. You are working with kids that are coming in with severe, some domestic violence that occurred at home, or, their friend was just in a horrible car accident. There's so many different issues that happen on any given day. And counselors are there's only, most of the time, unless you're in a really, affluent district that might have a lot more resources. There's, in the state of New York, it's about 630 counselors 630 students per counselor. Nationally, it's about 480 per counselor. The American Schools Counselor Association recommends 1 counselor for every 250. Thankfully, in the district that I'm in, that's about where we're at. But again, the expectation that school counselors are going to be able to meet with any student athlete that is struggling, that may not be able to happen, at least in the long-term basis. So in the meantime, you're kind of creating this culture in your experience in working with kids, recognizing how can you be helpful for them? How can you kind of set the stage that you're going to be concerned about mental health just as you would be about physical health? And so think of it as if a kid walked in and had, they were just playing football and they broke 3 ribs. Now, you can't necessarily see broken ribs, I don't think, but you might be able to have a conversation with about, like, how are you going to handle that? What are some things you're going to need in order to handle managing the pain and managing different things you need to do to get through your days? What do you need to do to manage broken ribs? How you kind of discuss mental health should be the same kind of track that you go on. when kids start to tell you that they're feeling really anxious, you can talk about, okay, what are some things you're going to do to manage that? What are some coping strategies you're using? Over and over again throughout this whole presentation, I really want you to kind of embrace the fact that it's just like you cope with injuries and you cope with sprains and different, pulled muscles, and you figure out what you need to do to cope. Same type of thing with mental health, recognizing that, okay, so you might, I think people get caught up, well, do they actually have a diagnosis? And we're not going to worry about that. I mean, diagnoses are helpful in many areas, but in reality, in your role, if a kid tells you they're feeling depressed, you're going to be like, okay, all right, well, tell me what's going on if you want to. Again, you have no expectation to suddenly be the counselor, but just like you would with managing the physical issues, you can say, I'm here, like, let's talk about mental health is just as important. So let's try to figure out what we can do to help you cope with whatever you're going through. And I think Meryl pointed this out as well, that there's a lot of disorders that it's not as if you turn, 25 and all of a sudden that's when mental health problems start. Most adults, over half of them, will say that they could tell that things were going on when they were young. So any of you working in high schools and in colleges, the likelihood that you're going to try to be you are going to be the first person to kind of say, yeah, let's figure out how we can work with this. Mental health issues ebb and flow throughout life, and helping them to kind of weather the storm and figure out how to manage those is the big piece here, that you want to set that stage in your experience with kids. So this pink quote right here is very similar to what Kevin Love was talking about. In the course of a lifetime, not all people will experience a mental illness, but everyone will struggle or have a challenge with their mental well-being. Just like we all have challenges with our physical well-being from time to time. Things like a car accident or a breakup with a relationship that you've had, or the loss of a loved one, or a pandemic, that will do it. Mental well-being is going to fluctuate. And I think we are such a psychologically savvy society that we're quick to say, well, is it a diagnosis? Is there, how do we treat this? What do we need to do? Do I need medicine? Do I need this? And in reality, everybody can kind of just embrace the fact that mental well-being right now, yes, is definitely the number of 150 to 250. Of course, I think every single person that watches the news is impacted by all of this. But that doesn't mean that everyone needs to be diagnosed with anxiety disorder or depression. Mental illness doesn't happen to everybody. It's something that, you might meet criteria for different things. But again, focusing on a diagnosis is not necessary in your role, nor is it. A lot of school districts, we're not focusing on whether or not kids are diagnosed with anything. We're focusing on what do they need. The medical model is not what we use. Educational systems look at student need. So even if a kid has been diagnosed with certain things, it doesn't mean that like, oh, okay, he's been diagnosed with this, we're going to do this then. It's not really how it works. What do they need? So recognizing that kids are very savvy, they will do these online, they'll do online questionnaires and they'll come in my office and be like, I just found out that I have bipolar. Or I just know that I have anxiety because I checked off all the boxes. And again, okay, if they think they have it and you want to talk with them, how do you cope with that? What are some ways to manage that? So don't focus so much on worrying about what a diagnosis is. Focus on what are their needs and how can you get them to feel that they're in a better place. But a lot of kids and even adults and even, I have a friend who is very organized. I mean, you can't see, but my desk is a mess right now and that's how I roll. But there are some people that are very tidy and we use oh, you're so OCD because and we're very quick to talk about mental health diagnoses, even though that's not really, they're not, just because someone's organized doesn't have anything to do with whether or not they have OCD. OCD can be very debilitating. So recognizing that just because people have certain traits doesn't mean that it's impacting their life to such a level that they need a diagnosis. Okay. Right. So we're going to get into some of the main common health concerns that I think in terms of secondary school might be relevant to all of you. And please, if there's questions or I'm not, explaining something well, feel free, jump in and type a question to me. And I'm trying to keep tabs on them, but Allison, I'm sure will let me know. In terms of mental health concerns, again, these are concerns. It doesn't mean they have to be diagnosed with them. It's just a matter of, I could talk about each of these for probably an hour or more, every single one of them. So I'm going to try to move along here and make sure I can cover all of them thoroughly enough so you can have a better understanding of things. So let's start with anxiety. Anxiety, I know you all know what anxiety is, and I know, it's very common. There's, in terms of kids under the age of 18 that have been diagnosed with some type of anxiety disorder, it's upwards of almost 32%. So it's very common, but I want you to know if you've met one kid with an anxiety disorder, you've met one kid. All anxiety disorders and how they present and how kids will talk about them and what their needs are so different. So 100 kids in a room that all have anxiety disorder, and they all might have different things that they feel is what's upsetting to them and how they need to manage it. So, generalized anxiety disorder of just being really having a hard time managing demands and worrying about everything is very different than PTSD. Which PTSD is much more, it's trauma-based. There's some type of trauma that occurred. And again, so you're not going to focus again on the diagnosis. You're going to focus on what are their needs and what do they need to get through and what do they need to cope with in order to kind of make it through their days. So when they lay their head on their pillow at night, that they are sleeping well and that they're able to kind of wake up and do it all again the next day. Anxiety disorders can be exhausting. And in the world of student athletes, in my experience, especially, you're working here at a high school, some of our highest achieving students are these amazing athletes that just want to be perfect. And I think helping them deal with that level of overachievement and recognizing that life isn't going to be perfect all the time. And again, does it mean they're actually diagnosed with anything? No. But you and the coaches and their whole kind of support team needs to kind of reiterate over and over again how to cope with all these pressures they put on themselves. We talked about burnout earlier, and that I think when it gets to the point where they start to not be able to handle all the demands. So in the world of a high school, I love it when kids are involved in sports because it gives them that routine, it gives them a social network, it gives them all kinds of things that I want them to have. But when we put too much pressure on themselves and they end up quitting the team, and then the school becomes too overwhelming and they stop coming to school, and then they're not even leaving their house anymore. So anxiety can kind of, steamroll effect and kind of get worse and worse. But it doesn't have to. There's a lot of different strategies along the way that, again, you're going to set that stage of kind of talking about mental health and how you're going to, what are some things we can do to manage that? What are some tips? So in terms of tips, again, for student athletes to cope with anxiety, this is good old Justin Bieber here back in last year. Psychology Today posted this article all about how to handle the 5-4-3-2-1 method. Kids talk about this a lot. Any kid that goes to counseling will often be like, you can always, if the kids are in counseling, asking them, well, what strategies are you learning? And a lot of counselors, school counselors, outside counselors, social workers, they'll talk about the 5-4-3-2-1 method. And this is something you could even, post in your training room. 5 things you can see, 4 things you can touch, 3 things you can hear. It's just it really is all about when kids are getting themselves worked up, how can they bring themselves kind of down to a functioning level? A lot of it is just changing your sensory input. So I have a number of students that will stop in my office here and there, and I have a whole pile of which I'm not allowed to really have anymore because of coronavirus, so nobody can take anything, but I'll have to wrap individual ones, but stress balls and different little gadgets that they can play with. And a lot of times they'll take them, and sometimes they'll bring them back, sometimes they won't. But I have, again, changing their sensory input. So I've had students that say, well, I love it when I start feeling myself get really worked up, I just pop an Altoid. And again, is that going to work for everybody? Of course not. But with certain students that might have just, they know that they get themselves worked up, can take an Altoid and maybe be able to calm themselves a bit. When it comes to that, to tapping techniques, I'm not well-versed in the world of tapping. This is something that's relatively new over the course of the past few years. That's kind of been, kids will talk about it and they will mention it. There's a lot of YouTube videos and a number of different therapists will talk about it. It's again, pressure points. It's not, I think it's rooted in, I can't even think of the word. It's rooted in different pressure point experiences, but tapping is it's doable. Like these are things, all of these tips that I'm talking about are things that you can, if you have that relationship with students and you've talked with their parents and you kind of have an idea that the kids could handle. Hey, have you heard about tapping techniques? I don't know much about it, but it's something that might be helpful. Look into that. And again, you're not talking about medicine. You're not encouraging them to do anything out of the ordinary or something completely that's going to hurt them potentially. You're literally just giving them tips and different ways they can cope. One of the biggest ones that I think most of you are well versed in is the fact that when kids are really upset, or maybe they have a broken arm and you run out onto the field and one of the things okay, just breathe. Okay, look at me and breathe. Breathing apps and breath work is huge in the world of anxiety, helping kids to kind of regulate their breathing and be able to kind of bring themselves back down. That is, there's a number of different apps, which I think Dan's going to talk about later today as well. Encouraging them, well, there's lots of different apps. Go online and see what apps you can find that are helpful for you. There's even I've seen a new necklace that it's kind of like a straw, a fancy straw that kids can breathe through each day if they feel like their breathing is getting dysregulated. Okay, so these are simple, basic techniques that might work for certain kids. Again, because you don't know when they're going to go to counseling. The hope is that they get into counseling right away and they're going to learn all kinds of great strategies and how to cope. But sometimes it doesn't happen right away. So you're really kind of, what can you do in the meantime? And just having different ideas. And sharing ideas with parents as well to let them know, hey, why don't you try this? Why don't you try this? Onto depression. I know you're all familiar with depression as well. In the world of depression, there's, again, you get 100 kids in a room all diagnosed with depression and they all might have very different symptoms. In general, a lot of males might be more externalizing in their features. They might be more irritable or more prone to acting out, whereas females might be more prone to just cry or feel unmotivated and not want to really engage. So depression, depending on the age of the student and kind of where they're at, they can present lots of different ways. And the big piece that I want you to take away is, what is your view of what's normal for that student? Okay, so if you're new to a district, you're not going to know how students act because you haven't worked with them in a while. But if you're familiar with some students because you've worked with them for a long time, you're going to know there's going to be some students that are just kind of, and that's why I have Eeyore here. Eeyore, there are some kids that are just low key. They kind of always look at the world a little bit negative. They may not be the most engaging personalities. They might be great athletes, but on a day-to-day, they're pretty chill and they don't really get, rattled by much of anything. And they are, they don't really seem to care about much, but that doesn't mean they should be, you don't need to say, oh, I think they're depressed, because people that first meet them, for instance, when I have teachers that meet students at the beginning of the year, they often will come and talk to me and be like, what's up with so-and-so? Is he really that depressed? I'll be like, no, he's not depressed. That's kind of just, that's how he is. And you'll get to know that. And so once you get to know kids, you'll see that the range of normal in our world, we definitely, when kids kind of act out of the ordinary of what we think is normal, we kind of want to say, well, do they need something? Sometimes they do. But other times, once you get to know a student, you can recognize, well, this is the norm for them. So the bigger concern would be is if the kid that generally acts like an Eeyore suddenly becomes, very exuberant and is super overreactive about everything. That should be more of a concern to you when there's a sudden change of behaviors, as opposed to just kind of a, getting to know a kid. So the opposite can be true too. They're a kid that's generally really exuberant and might be the life of the party all the time, very talkative. If that child, if you meet with them, a few months later and you're like, what's going on with you? And they start talking about kind of not really feeling motivated, that's where the difference is. So depression, I think people kind of have this perception that everyone has to be kind of at a certain level, but the baseline for people vary. Everyone's baseline might be a little different. So you need to say, where's this kid's baseline? And if they're, generally not this, hyper kid, that's fine. Okay. So how do you deal with student athletes in terms of how to encourage them to cope? And one of my biggest, for years, what I've been frustrated with, I want kids to get rid of their phones. Like, stop looking at your phone, put it away. Phones can create a whole world for a kid that cannot necessarily be positive. I've realized that trying to keep the phone out of a kid's hands it's kind of, any of you that have teenagers, you'll understand what I'm saying. It's not going to happen for many cases. But what I can encourage is, let's look, what are you following on Instagram? What are you following on, not a lot of kids are on Facebook, but what people, are you looking at funny cat memes all the time and, cat videos? Great. But if you're following, the Kardashians or all these, famous people that are really making you feel like you don't have enough, you're not skinny enough, you're not pretty enough, you're not this, you're not that. That negative input constantly, every day, hours a day, especially in today's times where all the kids have a constant flow, and a lot of them, social media, I know has been super helpful because they can continue to engage with their friends. However, what is the constant flow of information they're getting on their social media networks? What platforms are they using then, and how do they make them feel? So talking with students, well, what are you following? Say what? And I've even had students, I'll be like, well, go on your Instagram right now. I want to see what are you on? And I'll say, does this make you happy? Does this make you feel good about yourself? And they will be like, no. I go, well, why do you follow that? Why don't you get rid of that? You don't have to. Take a mental health break. If something doesn't feel good for you on social media, move on, delete it. Which again, communicating that with students, especially 14-year-olds and 15-year-olds that, are just kind of getting, depending on their age, getting into the world of social media and realizing how powerful it can be. It's really important that you model following things that make you feel good. Same for all of you. If you're following things and you're on Facebook and you're following things that stress you out, and I tell this to people all the time, you don't have to follow all the political posts or all this. If things are making you frustrated, to stop following them. And kids don't necessarily always think about that. So modeling that is really helpful. And I know you're all familiar with Likert scale. I know you do this with pain and things like that. You can do the same type of thing in terms of mental health. And it's really important for kids to kind of be able to recognize, well, I've been feeling like a 1 for 3 days, but today was a 5-day. And helping them to kind of gauge that, because a lot of kids get into the all or nothing thinking, like they have to, they're like miserable and they're always miserable. But you can remind them, no, you last Friday you were feeling like 5. So helping them to recognize not every day is bad. Activity, exercise, socialization, obviously those are big ones. And again, right now in the middle of a pandemic, not always that easy. But just encouraging what makes sense for them and how they can cope during this time. Encouraging a mantra. I do this with a lot of kids. Every time they leave my office, we talk about, what's your mantra going to be? Like, what's going to keep you going? And if you can get that, or even if you have something that you say, I know a lot of people say, you got this. And kids, when you say it over and over and over again, they will take that. They will have that in their head, and that's what you need. Personality disorders. In terms of personality disorders, you're probably thinking, well, personality disorders they're not even supposed to be diagnosed in kids, right? Technically, no. Personality isn't really set until you're considered 18 or so, but I've seen more and more and more kids that are coming in and they'll tell me, I was just diagnosed with borderline personality disorder. And I'll be like, really? Okay. So tell me about how you handle that. What do you need? How do you cope? So a lot of times in the world of personality disorders, you might not have many kids that have any type of personality disorders, but you will know the challenging athletes. If you have a student athlete that is a lot of work in terms of, there's a lot of kind of behavioral nuances, and they get upset with other players and they're blaming other people, and there's a lot of issues. You know, looking back through their history or talking with them about their history or talking with their parents about their history, there might be a long history of a variety of mental health diagnoses. They may have been diagnosed with ADHD, maybe about 7, and this is just an example. As they get older, they have some major behavioral concerns, and they were diagnosed with oppositional defiant disorder. And then as they entered middle school, they struggled with kind of their mood, and they were diagnosed with bipolar disorder. And again, this is another reason we don't get caught up in diagnoses in the mental health world a lot of times, because they change all the time. So by the time they're in, let's say high school, they have this, very challenging relationship with others. They might be best friends with someone one day and then they hate them the next, and you're like, what just happened? Personality disorders are usually they're a little bit of everything. You could, any given day, they might be talking about their anxiety or their depression or their cutting, which we'll get to next, or there are all kinds of different behaviors. So if you have a really, really challenging athlete and you're like, I don't know what to do with this kid, like they have all kinds of different symptoms, it might be more of a personality issue that is a long history, and there's no fix for it. It's not like there's a medication that fixes personality disorders. Again, what does it go back to? Figuring out how to cope and recognizing that there's management of how you can address these different needs. A lot of kids that are in the world of kind of this emotional lability that they experience with personality disorders, they sometimes have been hospitalized for suicidal ideation a number of times. And then when they come out of the hospital, that's when they were given the diagnosis of borderline personality disorder or some type of personality disorder. Borderline at the high school level is the most popular, most common, I should say. So how do you deal with these kids that are really challenging? And number one, I want you to kind of focus on your own coping with how you're going to cope with them. Because they might say some really hurtful things. They might yell at coaches. They might go home and talk about you or other players on the team. And then you have parents that are upset. And then don't take things personally, which I know is easier said than done. Be consistent in your approach with them. Like, again, even going back to having a mantra that's going to help you develop this relationship with the student. Recognize that their triggers, if they lose in a match or a game or on the field, and they have kind of explosive behaviors afterwards, prepare yourself for that. Prepare kind of how you're going to handle that, and be aware of splitting behaviors. And that's simply the all or nothing thought process, that I either think you're wonderful and I want to be talking to you all the time and I think you're God, versus I hate you and I don't want to be around you. So sometimes kids with personality disorders flip-flop, and you're just trying to keep up all the time. How to support the student is really kind of reminding them and helping them to say, we're part of a team, we care about you. Sometimes it's helpful if they educate themselves about the disorder, but I would recommend making sure you have if you can have a consistent therapist, that would be great. I mean, again, a lot of kids with a long history, they've gone through lots of different therapists, and their parents might be frustrated, and there's a number of different concerns about it's just the way they are. Like there's no fix, but there is fix. There is some support, and there is ways of understanding how those kids are interacting with others and recognizing how, they get better and better at being like, I know I'm just fearing abandonment right now, and that's why I'm acting this way. And if they're able to say those words, it's so helpful. So there's a whole link down here about helping someone with borderline personality disorder. And again, you'll get these PDF slides sent to you. Okay, cutting, self-harm, eating disorders. I think these are the ones that, you know, often get you worried. There's cutting, I will say in general, cutting isn't a suicide attempt. I think there's this concern that if kids are cutting, that they must want to die, and they're trying suicide. That's not the case. 9 times out of 10. They simply, you know, just want to feel something. But you can have about 4 kids that each are cutting, and they might have different reasons why they're doing it. At the younger levels, I see a lot of kind of peer influenced cutting. So fifth graders, I often have little pockets of 5th graders that start cutting, and it's really, you have one high status peer that starts cutting, and then other kids are like, oh, well, you know, let's try that. Remember the Tide Pod challenge on YouTube, and there's also been the cinnamon challenge on YouTube, and the freezing where you'd put ice and salt on your hand and you try to keep it there as long as possible. Kids were burning themselves, and kids were coming into school, and it was like, what are you doing? Kids, you know, kids love novelty seeking, anything new and exciting, especially the younger ones. They're going to try it because that'll be fun. And so cutting sometimes is very peer influenced at a younger age. But as they grow up and, you know, as they age, cutting is sometimes just related to more of a coping skill for other issues. So if you see a kid that's been cutting, like you hear about it from another student, you see it on their arms or their legs, talk to them about it if you want. Again, this is where, you know, cutting can, you know, I don't want to tell you to do something that you don't feel comfortable with, but if you have a relationship with a student and you know your coach is supportive and you know, it's okay to say, hey, tell me what's going on there, and see what they say. Again, you want to reiterate that you're there to help them cope, and cutting isn't the best way to cope. A lot of times when I have kids that are cutting, if I'm concerned about it, because of how deep it is or how severe it is, I will encourage, let's go to the nurse. I'm just reading a question right here. Okay, I will get to that. Okay. I went backwards. Let me go. In terms of cutting and trying to figure out how to handle that, again, I don't want you to start going into a conversation you don't feel comfortable doing. But again, kids that are cutting, think of it as a coping skill that they're doing that isn't working for them. Cutting, especially if it's bad, you say we need to make sure that's not infected. And sometimes having them meet with a nurse just to make sure it's not infected, things like that might kind of open up some discussion. More serious chronic cutting in general is on the thighs and on the stomach. So kids that are cutting in places you don't generally see unless they're a swimmer, that kind of raises the bar of, you know, how severe is this strategy that they're using to cope with whatever they're doing, whatever mental health issue they're dealing with, and helping them to say there's other ways of managing coping. Like managing cutting isn't the best coping mechanism, and they will know that, but you got to give them other strategies. And things like a use of a rubber band. And again, there's a lot of these things. If it's a severe cutting case, you're going to refer to the school counselor, social worker, school psychologist, a mental health professional. Okay. The expectation is not that you're going to deal with all of this yourself, but this is one of those opportunities. You want to steer them in that direction. Okay. And this goes for anything. Some kids will burn themselves. Again, they'll do a lot of different, what I see a lot, again, with younger kids is they take an eraser and just rub their hands to make marks. And again, is it life-threatening? No. But is it concern? Yes, especially if they're doing it chronically and it's causing an issue. One of the questions is, when trying to provide the best support for student athletes in different scenarios, especially when there are some significant mental health red flags and there's no support at home and there's no home life to speak of, what are your suggestions to best troubleshoot this? And I think, the beauty of being a student athlete is that they're part of something, and helping them to say, all right, so you're part of this, let's work on your social network. Who are your people that you can reach out to? And what I work on with kids when they don't have a family support, you help them to develop their hand. Like, 5 people that they can reach out to. What are 5 people that I know mom and dad may not be helpful? You might not have anybody, but maybe grandma who lives, a town over. Have them, encourage them to name 5 people that they can reach out to. And if those 5 people are all in the school district and all people that, again, that might be who they name. So if the child has some pretty significant needs, the school, I'm sure, already knows, but encouraging that communication and steering that child to those people. And eventually, kids will find their people. They will, especially with the help of an adult. So if support at home isn't there, which happens a lot, we really strongly, help kids. Like, who else do you have? Who else can be your people? And that's a given regardless of whether or not they have mental health needs or not. You're really trying to help them develop a support network for their life. Okay. Now, eating disorder behavior, this is not, this training is not extensive enough to go into eating disorders at length by any means. And I am not an eating disorder specialist. Eating disorders are very serious in many, if it's a long-term issue in the world of mental health disorders, not to scare you, but in the world of mental health disorders, the disorder with one of the highest fatality rates is eating disorders. So I strongly encourage you to have kind of that plan of how you're going to handle a student that you perceive to have an eating disorder. And the thing is, you have to have the coach, you have to have the parents, you have to have everybody kind of on the same page, ideally, in an ideal world. And that's going to be your tough, the tough call. Eating disorders are not just about food. Okay, they sometimes have nothing to do with food. It can be about control. It can be a symptom of some anxiety. In my experience, I've worked with a child that had severe, debilitating obsessive compulsive disorder. And she couldn't eat because she had to regulate her swallowing with her chewing. And so she had to chew a certain number of times and then swallow a certain number of times. It would take her an hour to eat one piece of toast. She couldn't just eat casually because she had to regulate all of those things. So, kids that really struggle with eating and have that disordered mentality of eating and body dysmorphic disorder and all of that kind of, you really need to kind of have a united front of how your coaches and families that you work with, how you're going to work with that. And so I would strongly encourage you to go to the resources available to you. So post-concussion syndrome, and the reason I want to talk about this is because this is a lot of times kids, if they have a head injury of any kind, and to be perfectly honest, in the world of, I have kids, and I would rather have my kid break their leg than have a head injury of any kind, because the ramifications and how severe it can be sometimes are just so unknown that, I think there's many kids that get hit in the head and then they have migraines for a long time, and the parents are trying to manage all of the, they still want to play their sport, but they're worried about the stress level. We get a lot of information from doctors that will say this child, and this is not just student athletes. We have, students of, from all different backgrounds that have different levels of head injuries and concussions, and they are requesting testing modifications or different, they want to change the lighting in a classroom, or they want to have half the amount of homework and less stress, and they need to have, and it's doable within a school district, but you need to make sure that those forms that are being sent from doctors are actually getting into the right hands, because we get a lot of parents that are frustrated that schools are not doing everything that the doctor says, but if you don't go through the proper channels, you may not, you need to have certain meetings. If it's a long-term kind of process of how you're going to handle this student, then you need to have kind of documentation in place. So districts are not just going to follow what a doctor sends in without having the proper people look at it and determine what their needs are. Again, it's all about what does the student need. And you'll have some students that I don't want any extended time. I don't want to do that. So make sure the student is on board with what the recommendations are that are sent by the doctor. So post-concussion syndrome can kind of lead into all different kinds of frustrations if it's not kind of planned out with everybody involved. Okay, suicide. I'm just seeing how I'm doing on time here. Okay, suicide. Suicide is a topic that is very triggering for a lot of people, and I'm sure all of you have had some type of experience with suicide, know someone, or heard of it happening to someone you love. In the world of suicide, it can rock an entire community. Here in the community that I work in, over the past 9 years or so, we've had 3 young men complete suicide. And it's, again, it creates this ripple effect, and you have to make sure that how you handle things makes sense. So really, when it comes to suicide, follow the protocol for your district that you're working in, or what organization you work for. So just like way back when Tony was talking about having a plan, you know, when it comes to, if a student says something to you, literally like, I don't want to live anymore, and I want to die, and I'm going to kill myself. What are you going to do? And I would love to say exactly what you're going to do, but all of you are in different situations, and are you going to tell the coach? Are you going to call your AD? Are you going to call the administrators? Are you going to call the parents? And I can't say exactly what you would do because it depends on the district and kind of what their protocol is. But I can tell you, in the world of kind of helping people, if your friend or somebody you know were to say that to you, what would you do? And in that case, I want you to feel like there's all kinds of crisis numbers. Calling a crisis line, I call them all the time because, you know, and we're going to talk about this, but going into the hospital, there's not a lot of hospital beds. So kids are not necessarily going to go to the hospital and be admitted. So a lot of times you're going to talk things through with the crisis counselors online, and you can put the kid right on the phone, and you can help support them through that first call. And that way they have that resource. I have little flyers in my office here of different phone numbers to call that kids can, I hand to kids and say, reach out to this person, but it's really hard to make that first call. That's why texting, you can text help, you can text home, you can text lots of things, the 741-741 number. What will happen is kids will text that number. I've even had their phone, and I text it for them. And then there'll be an automated response that will come back and say, we'll be right with you. I will say, you know, as times, you know, the demand on this, the texting line has been pretty high. So sometimes you have to wait for, you know, up to 10 minutes or so for someone to start talking with you. And again, the demand, I haven't had to reach out lately, so I'm not sure how long of a wait it is, but you can remind kids and help kids through that process, and help adults and anyone that's needs this level of support. But in terms of just when do you start to worry, the basics of, if they say, I want to die, obviously, and there's that loss of hope, you can't get them to say anything positive, and you can't get them to even express any level of hope. That's another, like, we're upping the ante here. If there's been a stressful situation that they've gone through, like their parents just got divorced, or they've just broke up with their significant other, or they, you know, some kids, they failed a test, and it kind of ups the ante. And then the biggest one I want to say is access to lethal means. If you have a kid, you know, where I'm located, we're pretty rural. There's a lot of kids that have guns, have access to guns, know how to use a gun. Part of the issue of the increased rate of completed suicide is the access to lethal means. So if they know, if they talk to you about having a rope, or they talk to you about having a whole bottle of pills, and that's access to a lethal means. You need to be very kind of cognizant of, if they've met, you know, they're kind of ding, 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 all these things that you're like, okay, this is worse, this is worse, this is, then you don't leave that kid alone. And you figure out, again, you can get crisis services on the phone, and then you're going to follow whatever protocol makes sense for your organization or your district. And we have lots of, you know, every district has a crisis response plan. So this isn't something we do this a lot. So if you don't know what that plan is, reach out and find out. So what is the curriculum for suicide prevention? Here at Newfane, we use Lifelines, which is the kids are all trained in this. I apologize for this horrible that facts sheet. It's not the greatest copy, but all of the kids in 7th and 8th grade go through curriculum all about how to recognize signs of suicide in their friends. There's all kinds of flyers. We do parent trainings. So Newfane's not alone. Every school district has a lot of suicide-based resources. So find out what they are in your district. You don't need to reinvent the wheel. There's a million flyers that I have in my office. I'd be happy to send out. And I think any school counselor in any of your buildings, there's a lot of resources. You just need to know who to reach out to and kind of what your team approach is. For those of you who are like, well, what if I'm away on if the team is like in Syracuse and, we're on a trip, same type of thing. You can still use crisis, the crisis numbers. You can still use that protocol of who you're going to talk to. And you're going to, you have that relationship with your coaches and know kind of what the angle is going to be. The big piece I want to point out though, is many kids are not admitted to the hospital. So you're going to go through all this. You're going to be very worried about a kid. And then they won't be admitted. Here in Western New York, there's very few for kids under the age of 17 and under. There are very few hospital beds. So ECMC has the CPEP unit. So they have the adolescent unit and they have the adult unit. And kids will go there when it's warranted, when it's pretty severe, and they will not be seen by anybody for up to, and I'm not joking when I say this, that it'll be days before they are, whether or not they're admitted. So parents can get very, very frustrated if you are working with them and they say, well, we're not going back to the hospital. They weren't admitted last time. We did that before. So this becomes really tricky. The mental health world is really a struggle. You have to know, we will, when we have parents come to the school if we insist that they bring their child to the hospital. If they do not bring them, then we can send them by ambulance. CPS can get involved. I mean, there's a lot of different steps here that in general, in your role, you are going to steer, you're going to steer the ship. What services do they need? And then you're going to have the mental health professionals get on board. But I want you to know, a lot of times kids, they may not be admitted, even though they said all kinds of, really horrible things that you feel like, well, they need major help. And I get that, but they may be right back in school. If it happens on a Friday, they'll be back on Monday. So they need to meet the criteria in order to be admitted. And the key word here is imminent. So by the time they're seen, it might have been a couple days and they're no longer at imminent risk of hurting themselves. So understand that sometimes happen, and you may feel like that's a disservice to them. And I'm not arguing with you, but that's the way of the world right now. There's very few places that the psych unit at Lockport Hospital that was meant for students that closed last January. So there's nowhere for students to go. So a lot of times the beds are full. They can go, Brylin does have hospital beds for students, for kids even younger than 12. I'd like to point out ECMC only takes 12 and above. You can go there if the kid is under 12, but they will have to figure out where to send that child if they're admitted. They're not going to stay at ECMC. So Brylin doesn't even have a emergency room. You have to call and speak with somebody about whether or not you can get in there. And again, if there's no beds, there's no opportunity to be enrolled. So what do you do how do you handle the fact if a kid comes back after this potential, crisis of their mental health? A lot of times you may not even know that the student went through this. I mean, I can't tell you how many times that families don't necessarily communicate that to the schools or to anybody. So you might find out through another student that so-and-so was hospitalized for, maybe a week or a few days, but you might not find out from the student or the parents because there's that stigma involved. So what are you supposed to do? And I think that depends on your relationship with a student. if you were involved in the process of getting them to the hospital, then obviously when they do come back, what do you need help with? Again, what can I do to help you manage your needs? And what are some coping strategies we can help you with? A lot of times I help students decide what their story is going to be. Like, what do you want to say if kids ask you where you've been? And you let them decide their story. And that sometimes when kids have gone into the hospital and they come out, they sometimes have had medication changes, and the medication can definitely alter their demeanor and kind of their alertness. We have kids that'll fall asleep in class as the medication kind of is adjusted. So just be cognizant of all that. So the big piece here is that you're part of a system. When you work in a secondary school, you are part of that all of those people that work with students throughout the day, and you have the opportunity of having many times a pretty close relationship with some of these students because you see them fairly often. If you need to reach out to the school and your contract and you don't necessarily see you don't see school counselors, you're not there at the same time they are. But if you want to reach out to them, in some cases you might need to a release of information form for the parents to sign. And most parents will say, sure, whatever help you can get me, I'd be all over. But it's really kind of coordinating our efforts. So find out, even just go on your district website, find out who the people are, find out who the counselors are. That way, when you're talking with a student, who is it that, might be helpful. And if you don't have a good experience with one school counselor, call another one. So, that's the thing. There's lots of different people that work in the schools, and some are more helpful than others. There's also, please, if you don't have access to flyers and you want flyers on certain topics, there's a lot of them. Do not reinvent the wheel. Do not feel like you need to research all of this. Walk down to the guidance office and say who you are, and they have lots of different information for you. And they'd be happy to share it. And again, have a little area if you have the opportunity and you have the space in your athletic training room to create that this is your mental health matters just as much. And I'm here to kind of walk you through that and figure out ways to cope. There's lots of different resources here that I pulled information from. This is my virtual office. This is the new wave right now. I have our high school students are hybrid. So they're here a couple days and they are not here 3 days a week. So only here 2 days a week. So trying to figure out times to meet with them. So this is the new wave of my little Bitmoji. She looks just like me. All right, any questions?
All right, Beth, that was awesome. Thank you very much.
Thank you.
We'll keep this up for a little bit here, and if anybody has any questions, please forward them through the question and answer line, and we'll get those addressed. And we're kind of in a good shape right now, so we'll plan on starting at 11:30 with Kelly Piper, and the next presentation that gives everybody 10 minutes for questions or potty breaks or lunch or whatever you may need. And we'll start again at 12:30. Nope, 11:30. Thanks, Meryl.
Okay, can you hear me?
Yes.
Okay, I was going to answer this question that came up. I don't know if anyone's still listening right now, but does that sound good, Allison? Can I do that right now? Or do you want me to wait?
I think that's okay. I think the person who answered the question or who asked the question will still be on to at least hear the answer.
Okay.
And whoever else is maybe looming around.
Okay. All right. So for those of you that are listening, when it comes to school counselors and social workers, it depends on the district. Like here at Newfane, we do not have any social workers. So we just have school counselors. So certain districts that have more, that have resources to have both school counselors and social workers, they oftentimes, school counselors are, especially at the high school level, are generally doing schedules and making sure credits are met and making sure graduation requirements. They also do some counseling, but they may only do the counseling with certain students that have it on their IEP, which are kids that are classified. They're not really doing, if kids are homeless, they're not working out of trying to figure out how to have resources provided to a family. So in general, social workers are much more involved with kind of the community-based supports and what services are available to students in the area. So like Buffalo City Schools, Niagara Falls, they have a lot of different social workers that are helping meet the needs kind of on a basic level, making sure there's food and making sure that there's everything a student needs to be successful. So again, certain districts have both. And if they do have both, again, the social workers are generally dealing with kind of the more, community-based supports that are available and helping families and things like that. I hope that answers your question. You didn't ask school psychologists. School psychologists have a whole nother job, and we're doing testing a lot to determine kids that are classified and the different services that they might need. So school psychologists are involved in doing evaluations. School counselors are generally keeping everything organized, and the social workers are keeping everyone alive. Okay, so in general. All right, so I have another question from, how do you suggest we approach the comment of, we are athletic trainers, not mental health professionals? This is what I would say. If I was in your role, and this is what I tell teachers to say, teachers are meant to be teaching the curriculum there, but you will, if you have anybody that works in the educational field, they'll say they're often doing counselor. I would say when it comes to overall health, that mental health and mental well-being is a big part of physical health. So, you're not a mental health professional. However, you working with preventing injuries and preventing the different struggles that kids are going through, you also, kind of some coping strategies to help. And when things are beyond the scope of what you feel you can handle, then you steer to those mental health professionals. So mental well-being fluctuates, just like, that pink quote that was in there. Mental well-being fluctuates. So you can say that, when mental well-being is being challenged for whatever reason, you can provide supports just like you would if a kid had a sprained ankle and you want to provide supports to help them. So I don't know if that answers your question, but. That we can use to post in our AT rooms or gym. I love your quotes. I would, when it comes to quotes, I have so many quotes in my office. If I could show you my office in real life, I go online and I post lots of whatever I like. And then what I do, and they're usually, just feel good quotes. Okay. And then I'm on Shutterfly, but if you're on Snapfish, whatever website that you download your pictures on, I make sure you can get the free pictures. So you don't have to get fancy and make big, huge posters. You can literally find quotes that you like, screenshot them, cut them, put them onto, download them onto Shutterfly or whatever platform you use. And then when there's free, you can get free 4x6s. You just have little ones sitting in your office that kids are looking at while they're in there every day. And those are the kinds of things, I have lots of students that read the same thing every time they're in my office. And that's they will quote those things. So if you want to create that, kind of sense of, I care about all of you, not just the physical part of you, I care about all of you, that you can put those right. There's lots of different ways to do it. Okay, thanks everyone.
It looks like we got one question, just maybe we could answer before Kelly starts. Are there any surveys that you suggest to utilize for high school students to gauge where their mental health sits as far as athletics, participation, absence, etc. goes? I know many schools are going virtual, which makes mental and physical assessments more challenging.
I can speak to that, and I actually wrote that down. I meant to talk about that when I saw the question was earlier. And before you even go the route of offering any type of survey, I would definitely be prepared for what are you going to do when you get all these surveys back and you have, 50% of the kids saying they want, that they're really, really struggling. What's your plan? So before you kind of get a survey out there, you need to make sure you have your administrators on board and your, counselors, psychologists, social workers, all hands on deck, because the problem will be you send this survey out, you get all this information, and then what are you going to do with that information? So before you kind of go down the road of offering a survey, make sure you have the resources to support the students. And again, that's if you don't have people that are going to be able to support. I'm not saying you shouldn't do the survey, but you better have, what are we going to do when kids come back, and again, what do you want to ask? There's a lot of different surveys in terms of, you know, if you're just looking at overall wellness, if you're looking at how stressed they are, you can make, you with your administrative team, what we do is like last year with the, you know, with the start of virtual learning, we put a Google form together, and it was linked to every single Google Classroom. And again, if you don't use this platform, or, you know, you're not familiar with this, the school districts each have their own kind of way of doing this, but we put out a Google survey that said kind of, how are you holding up during this? Do you want someone to reach out to you? Do you, do you need something? And then with that, all of us were ready, and we had a whole Google form that we were kind of a Google updated slideshow that we kind of knew which kids we were, and everybody kind of kept organized it, who was reaching out to who. That requires all hands on deck. So there's lots of different, depending on what it is that you're trying to find out. What do you want to know about the athletes, and what do you want to, what's your plan of when kids do reply that they do need someone, okay? But it's very doable. Google Forms, the kids are very familiar with, most kids in most districts are very familiar with completing the Google Forms and feeling comfortable expressing their opinions on that, okay?
Awesome. Thanks a lot, Beth. That was really good. So now we'll move forward, and Kelly Piper is going to present next. Kelly got her BA from Shippensburg University and did her graduate work at Temple. She's the Assistant Athletic Director for Student Wellness at UB and a sports psychology consultant. And her private practice is Kelly Piper Sports, where she works with athletes from around Western New York. So with that, we'll turn it over to Kelly.
Thanks, Scott. Let's see if I can share my screen here. You guys see that okay? Yes, hopefully. So I apologize if you're getting a little bit of background noise. I don't think that's my microphone. I have 2 Labrador retrievers that are snoring their heads off at my feet. So Meryl talked about fur therapy, and we believe in that wholeheartedly in my household. So if it gets really annoying, somebody just shoot me a message and I'll move them out of the way, but I'm sure many of you can relate. So just to give you a little bit about my background, I appreciate being here today. So I am a Buffalo born and raised. I was a student athlete. I was a swimmer. Went away to college to swim, ended up injured. I had thoracic outlet syndrome and some shoulder capsule issues going on, as many swimmers do if they've been swimming for a lifetime, right? And really, while I was in college, my athletic trainer was my lifeline. While I was packed in ice every day, they were my person. And so I give you guys so much credit for the work that you do. You wear so many hats. I think the self-care piece that's been discussed is so important. You know, I do sometimes wonder how you find enough time in the day to do everything that you do. I think, you know, your role is very often undervalued. So I just wanted you to know that I think you wear capes. I think you're fantastic. So kudos for everything that you do. That's how I got into the field of sports psychology, was really the psychological aspects of injury, rehab, recovery, athletic identity, those pieces. And then I moved back to Buffalo after grad school in 2001. And I've been at the University of Buffalo in the athletics department since 2001, and also in private sports psychology practice as well. So I wear both those hats. And the third hat, I think that's important to kind of share, as I'm sure applies to many of you as well, is being a youth sport parent. So I'm on both sides of the fence as we're kind of navigating what is oftentimes the crazy world of youth sport as well. And As Beth did as well, I'm happy to answer any questions as we go through. So just feel free to, just throw them in the chat or whatever works for you. So we're going to talk from the perspective of collegiate student athletes. I'm going to share with you a little bit about how we manage mental health and wellness at the University of Buffalo, as well as sports psychology or mental skills training across youth and collegiate athletes. So we'll talk about, for collegiate athletes, just general trends that we often see. I'm going to share with you a little bit about some of the specific things that we do at the University of Buffalo, the Mid-American Conference initiatives around mental health, which is obviously the conference that we participate in. And then the NCAA and the Sports Science Institute are continuously updating their research and the best practice recommendations. So we'll briefly touch upon that. So just to start out, some of the specific things that, day to day that we see around mental health concerns for student athletes. So as, again, preaching to the choir here, but as you guys know, student athletes struggle with mental health too. So I think, one of the barriers that, that often comes up is sort of the perception or the stigma that student athletes are going to tough it out. They struggle because they've, oftentimes been in a culture coming up through their system that, they feel like or they perceive that it might be frowned upon to be a squeaky wheel or ask for help. So that can often, create barriers to them feeling like they can help seek. If any of you had the opportunity to see The Weight of Gold, which is the recently released documentary that Michael Phelps helped to produce around Olympic athletes and mental health concerns, if you hadn't have the opportunity to see it, I would highly recommend it. Basically talks about this, just, even at the Olympic level, when people are, training at that level and have dedicated their lives to mental health, to say that even those athletes struggle, when I think oftentimes it's the opposite. When we have all our eggs in one basket, it can be really difficult to maintain healthy balance and mental health. So depending on what you read, 20 to 30% or, 1 in 5, sometimes you'll read 1 in 4 student athletes report experiencing mental health concerns during college. Common things, won't spend too much time on this as Beth just broke a lot of these pieces out. But, they experience depression, so it could be long-term or they meet criteria, for generalized or, clinical depression, or, life happens while they're in college. So it could be grief and loss. It could be identity shift, relationships, whatever's going on at that point in time. Anxiety is really what they report most often that they're struggling with. So whether it's generalized, social anxiety, performance anxiety, that's usually the signs and symptoms are most often pointing to that. Disordered eating. So again, whether they meet criteria for anorexia or bulimia, whether they are just showing disordered eating patterns of behavior, which I think more often than not is the case. It may not be a full-blown eating disorder, but we know that very often the culture of the sport that athletes may participate in may perpetuate some disordered eating behaviors. I also wanted to mention the term orthorexia, which many of you may be familiar with. This is something that at UB we really are, have spent a lot of time really helping our athletes to navigate, and that really is the trend of, quote, clean eating, air quote, clean eating, and some of the shame or fear of not eating clean enough, guilt around food choices, And a lot of that is perpetuated by social media, you know, and again, sport culture. So that is something that we found ourselves spending a lot of time really working through, is just kind of debunking those myths that for many of them, of course, their nutrition is key and it's a pillar to their success, but really that, you know, their attitude around food and their healthy relationship with food is, you know, it's a quality of life thing. And it's so much bigger than sport. So just continuing to have those conversations. Sleep disturbance, actually, collegiate counseling centers will say that sleep disturbance is what they link to be the most important mental health concern for college students is quality of sleep or sleep disturbance, because as you all know, it impacts everything, right? So we feel not the best version of ourselves when we're not getting our best sleep. So for any of them that may have, you know, chronic sleep disturbance, that's something that we would refer them to you guys as sports medicine staff and to see team physicians about. You know, if it's more stress induced or they need to do a better job as a college student of managing their time, those are things that would fall under some things that I would work on with them as far as behavioral shifts. Adjustment disorders, I mean, what about college isn't an adjustment, right? So transition to college, transition into their sport, out of their sport, you know, again, some of those concerns might be pre-existing and some of them may be when they get to college. So a lot of concerns on healthy relationships, so setting boundaries, coming to college, and, you know, confidentiality with parents and those relationships, violence prevention and intimate relationships with coaches and healthy communication, teammates, conflict management. And then the other piece is trauma, that whether a student athlete at the collegiate level, you know, has awareness or not of how previous trauma or trauma that they experience while they're in college may impact them. There's a lot of research that really supports the relationship between communication style and effective communication and coachability for a student athlete, and the challenges that can come from a student athlete that has experienced trauma and how it can be difficult for them to receive feedback and to communicate effectively. So the C's, challenges that we often see at the college level. So confidence is, and we're going to spend more time when we talk about the mental performance side here in a little bit, but just as humans, confidence is so key as far as them being successful as a Division I athlete. So we talk about what they believe about themselves, foundational beliefs. Beth touched upon that perfectionistic mindset. So we try and replace their perfectionistic thoughts with, you know, thoughts about how they can be excellent and just shifting how it sounds in their head. You know, there's a lot of things that they've done well to get to that moment. They're high performing people, so we don't want to lose sight of that. But, you know, chasing perfectionism can be a really difficult thing long term as far as their overall well-being. Believing in their preparation. I always talk to our freshmen when they come in about sort of believing in what got them to this moment of being you know, a new student athlete, is that, you know, it's like training for a marathon. So we have to remember all the preparation that they put into this moment. It doesn't disappear because geography changes. Learning how to fail forward safely and be vulnerable. Defining what success means for them in this new environment. And then communication is another huge piece. I think that, you know, for many student athletes, you know, they're taking on a different level of vulnerability and being away on their own and learning how to have tough conversations with teammates and be challenged. I mean, we know that, technology has kind of taken away a lot of this generation's opportunity to be forced into situations where they're doing those one-on-one conversations and learning by doing. So talking to them about communication as a life skill and learning through the opportunities that they have and having tough conversations with their coaches, receiving feedback, working with their instructors or academic advisors, and growing that life skill is a huge topic that we spend a lot of time talking about. Coping, so self-care, helping them have some self-awareness when they get to us about, because many of us, we cope, everybody has their own coping strategies. How healthy they are and how helpful they are for our long-term success is another story. So helping our athletes to kind of identify healthy and unhealthy or positive and negative coping strategies that they currently engage in. Helping them understand that, it's okay to be unbusy sometimes, which has been a conversation pretty often over the last 5 or 6 months. Giving them some ideas on how to self-regulate. So when they are feeling, overstressed or overwhelmed, giving them some tools to be able to manage those things. And stress and anxiety are, daily conversations around, the grind of being, a student athlete at that level. The other thing that, we spend a lot of time talking about is this idea of connection. What a lot of research shows right now around, student athletes or students in general that are coming into college, right, and high school kids as well, is that, they are the most connected, air quote, generation that we've ever had because they have information at their fingertips. But how they actually feel is a totally different story. So they report feeling more isolated than they ever have been. And part of that, again, is social media, right? And the authenticity and the investment in those relationships and the value that brings to their overall well-being. So how this impacts our student athletes right now, it has been a monumental shift in all of these areas. So as most of you know, if you're in the local Buffalo area, you've probably seen that the Mid-American Conference is one of the conferences that made the decision to postpone all of our fall sports. I was actually on a call with our Student Athlete Advisory Committee. That's one of the pieces that I oversee within our department. It's a leadership group for our student athletes. We happened to be on a regularly scheduled Zoom call when, unfortunately, that information leaked through the media sooner than anticipated. So in real time, our student athletes our fall sports learned that their season had been postponed. So what do, right? You roll up your sleeves and you help to manage it. But, so helping them to understand, right, kind of backing up and understand the process, still being confident in what they've done well to be in this moment, helping them creatively stay connected and effectively communicate with their teammates, right? That social support piece is huge. So, with what's gone on, I've shared a lot, having been in the department for, 19 years now. We've had, tragedy happen over the years, as would happen in any other community. So we've had, student athletes that have tragically passed away from illness or from accidents. We've had, we've had sports discontinued, life happens. And so, helping with the grief and loss piece, has been something that, when you're in an athletics community, you have each other. What's different this time around is that there's that isolation piece. And so, when you see the statistics around what student athletes are reporting, the social support that comes with being part of something bigger than yourself is one of the most grounding pieces of this experience for them. And so when they're at home and they're zooming in, right, it just fundamentally changes, you know, how that coping can happen for them. So that has been, you know, a significant challenge as well. So to give you a little bit of an overview about how things look in our department, so I oversee our student athlete wellness area, which is pretty broad, do a lot of collaboration within the community and across campus. You know, there are some key pieces that we're required through the NCAA to meet around wellness education for our student athletes. And then we do have, our student athletes have a lot of input, really feel empowered to help direct some of the other programming that happens. We also have a licensed psychologist from UB Counseling Services that is embedded in our department part-time. So we are about 3 years into that model, which has been really helpful. Previous to that, you know, we would reach out across campus, and UB Counseling Services has always done a great job. They've been a great partner, but having someone embedded in the department has really been key. We do engage an annual wellness screen for all of our student athletes. We started that several years ago, and it covers all the bases of any of the topics I touched upon a couple slides ago, to get a baseline, and then we have a process through which we refer them based on any flags that may appear from that screen. Our UB Sports Medicine team, which is directed by Dr. Brian Brada, they're our first line of defense for any mental health concerns. And so I'll talk a little bit more about how that looks as far as our system in a few minutes here. We have a sports dietitian that is also embedded in our department part-time, which has been invaluable for us. And then we have annual education initiatives. So for any of you that are on college campuses, you probably have similar pieces where you have required educational components. So violence prevention, we do several pieces on sexual assault awareness, bystander intervention. We do alcohol and other drug education, diversity and inclusion pieces, mental health. And some of those happen annually, and some of them are kind of, you know, semester by semester. We also have a comprehensive student athlete wellness webpage that we really built out once COVID hit. I'd be happy to share that if anyone's interested. Some links were already shared that are included on there, but Headspace, Active Minds, some of those other resources that are pretty comprehensive are available for our students, as well as some other educational pieces. Lots of collaboration with campus and community partners. And then we have a mental health protocol and emergency procedure, which I will share. I just wanted to share a couple hashtags that our student athletes use and through the conference, really trying to reduce the stigma around student athletes and mental health. So one of them is, it's okay to not be okay. And the other one that we've used internally is, you are enough. And that really is driven from our student athletes being able to just be grounded in the fact that, you know, what they bring as human beings to their moment each and every day, just being where their feet are, right? They need to believe that they're enough in all areas of their life. They're going to continue to be coachable and grow, but just believing in themselves and what they bring to the table every day. So this is our mental health flow chart. I know this isn't the best copy, so hopefully you guys can see this. So if a student athlete presents with a concern, our first call is to on-campus counseling, if it's happening on campus. Student athletes, just like any student at UB, counseling services is included as part of their student fees, so it's of no cost to them. It's completely confidential, so their parents don't know unless they choose to sign a release to share that information. It's very safe for them in theory. Many of them still have reservations about, because many of them are higher profile on campus, so we try and work with them on, you know, having those conversations and sort of normalizing as we go along. But Brian Brada and the team athletic trainer will be looped in. And then depending on what's going on, whether it's, strictly a psychological piece or if there's medical pieces involved as well, we'll determine next steps, also severity of what the student athlete is experiencing and risk assessment. We have had student athletes obviously be transported, and we have student athletes that are not often, but are hospitalized. Obviously, again, depending on risk assessment and all of that. So again, happy to share, we have sort of further detail on this broken down. If anybody is interested, I'd be happy to share that. So wanted to just share these pictures. This is the self-care space and alumni arena for student athletes. Now it's a small space. We do have almost 400 student athletes. But just, I think as all of us are really looking for creative ways to, and you all as athletic trainers, you have time with them where they're often, receiving treatment, and there may be some pieces here that you could integrate into the care that they're receiving, just to offer them some self-care ideas. So in the self-care space, we have a meditation pillow, a yoga mat. Some of you may recognize on the shelf there what's called a happy lamp. So any students that may experience symptoms of seasonal affective disorder, that is a lamp that basically recreates sunlight for them, fake sunlight. So it's recommended to use a couple times a day in the winter time. Our counseling center also signs them out to students for the semester, but we have one there for the students to use. We have an essential oil diffuser, a salt lamp, and then on the right, the second picture is mindfulness and meditation prompts for them, and then sensory items as well. For any of them, if the computer lab is actually right next to, the student athlete computer lab is right next to the space, so they can stop in and grab a sensory item if it's helpful for when they're trying to study, or they're meeting with an advisor, or they have a tutoring appointment. That's actually been really well received. Just wanted to make sure to touch upon some sleep tips as well. I may be preaching to the choir a little bit on this piece of it, because I'm sure many of you are having these conversations on the value and importance of sleep, but over the last couple years specifically, it's been amazing to see the research that has emerged around the impact of sleep and injury risk, right, mental health, coping, just their overall well-being. So, and I don't think we necessarily needed research to tell us that, but it is helpful to support sort of what we're preaching to them. So here are some things, usually share, again, giving them some tools, some concrete sort of takeaways and tips of things to try so they can feel like they're in control of the process. So a mandala or sort of an adult coloring page can be very helpful. You can find them online for free and print them out and have them available if your students want to take one with them and try it. The repetition in the patterns is meant to be soothing. So many students have found success in trying that as a strategy before bed, just as kind of a grounding exercise. Sleepy time tea can be helpful, or just warm liquid in general that's decaffeinated can be helpful in helping them to sort of trigger a relaxation response. We talk a lot about routine and, again, time management. So building sleep into their schedule, not as an afterthought, but as a priority. So, and I think that's where a lot of them, competing at this level, they get hung up is, they end up they're awake till, 1 or 2 o'clock in the morning doing homework, or they're on their phone. So we talk about, making sure that they have their technology put away, and they have a certain timeline that they set, that they're disciplined about either journaling or having a relaxation routine, taking a warm shower, whatever works for them, trial and error. But I think this is something that oftentimes gets missed as being a pillar of their excellence. You know, and they may be used to just being chronically sleep deprived, like many of us walk around being sleep deprived and dehydrated and stressed. So we don't necessarily know the difference of what it might feel like to get effective sleep. And again, I'm no sleep expert, so this is from a wellness perspective. If they are chronically showing concerns or struggling with disruptive sleep or having trouble falling asleep, we would engage our sports medicine team and the team docs to further investigate that. So at a conference level, these are some of the things that our student athletes participate in. So I wanted to share this out just so you all had an awareness of, it's not just campus by campus, but at the conference and the NCAA level, we do have some recommended best practices that have come down the pipe, and these really shape how we provide for our student athletes' mental health. So we have an annual mental health awareness week. We have an annual diversity and inclusion week, and our student athlete leadership groups really shape what that looks like on our campus. We have an annual mental health summit in Cleveland where we gather. There's many athletic trainers and sports medicine team in the room, along with folks that are sort of in my role. Some academic advisors are usually part of the conversation, and then student athlete representatives from each campus. The Mid-American Conference does have an annual mental health protocol and institutional affidavit that is signed off by our athletic director. So Mark Allnut is our current athletic director. So every May, there is a full review of whether we've met this criteria, and then he signs off on it. So really, again, trying to encourage each campus to be really consistent and intentional about the mental health education and services that are available across the board. So we have annual education for coaches, support staff, and administrators. So this past year we did QPR training, which you may be familiar with. That was what we chose to do for all of our staff. Our student athletes went through bystander intervention training that they were all required to participate in, which also had some mental health components as well. We have a communication plan for reporting our mental health concerns, which I shared. The student athlete wellness screen. We do have a student athlete of concern team, which I would highly recommend, whether it's in a district, you know, or at the college level. And it doesn't have to look the same for each and every one of you. It's really just being able to kind of put your heads together and share ideas virtually right now with masks on, right? But being able to sort of share any concerns that you're seeing, or talk about, you know, ideas for how to provide for the mental health concerns of the student athletes that you work with. And then we have a crisis management team that's in place that is comprised of several of our administrators. And then confidentially, that information is maintained just to follow up and make sure that the student athletes have what they need moving forward. The NCAA best practice recommendations, and this is through the Sports Science Institute, clinical licensure of practitioners providing mental health care. So that has been a shift over the past couple years, that the NCAA has really gotten more specific in their recommended best practices, which is a great thing. That if there's clinical mental health care being provided, that it be provided by a licensed practitioner. Procedures for identification and referral of student athletes to qualified practitioners. So that is sort of having that flow chart for every campus or every department. And it can look different based on the size of your staff. And but for athletic trainers and for support staff, knowing who to call, knowing, you know, when they have a concern, who is their go-to person is just key. And then communicating that out so the coaches are aware and the support staff is aware. A pre-participation mental health screen, and then health promoting environments that support mental well-being and resiliency. So, you know, each campus obviously has much different, you know, budgets available and resources available based on, you know, the size of their campus and the size of their department. So there are some guidelines and recommendations through the NCAA as well, you know, on just different ideas on programming that's available for student athletes around this recommendation. So I just wanted to share this. These are some of our fabulous student athletes. This is one of our social media campaigns around mental health that they participated in this summer. So if you can't see that, it says, "You matter, your future is bright, you are enough, you are more than an athlete, and visualize and practice the person and athlete that you want to be." So important for student athletes to be, you know, carrying the flag on just normalizing mental well-being to their peers. It's been a huge piece for us. So switching gears a little bit, I wanted to take a few minutes and just talk about mental performance. So again, kind of wearing both hats of working in the college setting as well as in private practice. I see athletes from about age 9 or 10, and then all the way up through, you know, if you're, you know, a grandparent and you're looking to, you know, run your first marathon and everything in between, all levels of competition in all sports. So for you all as sports medicine staff, I think that there's just some really key pieces here around tools that you may be able to share with your athletes as they're in treatment. You know, they're staring at the ceiling, or, you know, maybe they're scrolling through their news feed. Maybe there's some pieces here that would be valuable. So when you're talking about mental performance, also called sports psychology, performance enhancement, mental toughness training, peak performance skills training. So there's really two different avenues. The educational sports psychology, which is my area of focus, focuses on mental toughness, skill development, motivation, athletic identity, team dynamics, that side of the fence. Clinical sports psychology focuses on the mental health aspects, so depression, anxiety, eating disorders, adjustment disorders. I am not a clinical practitioner, so I refer out, if it's at UB, obviously, to our counseling center, and I have, you know, several colleagues in the West New York community that I work closely with as well if we move into kind of the clinical side of things. So I wanted to share a couple case examples just to frame out for you, you know, in private practice, you know, what do parents reach out to someone like me looking for help with? So just a couple case examples to sort of give you a framework. So I'm looking for guidance for my son. He puts too much pressure on himself while playing sports and can't regulate his emotions in game situations. He gets so upset at mistakes and errors, it impacts his playing ability for the rest of the games. She has talent in her sport. She does amazing in practice, but when it comes to competition, she just struggles to control her nerves enough to put all of her skills together. She worries we will be disappointed with her or how she performs. She is an excellent student with a super work ethic, but her anxiety also rears its head when it comes to taking tests. And for many of you, you're probably nodding, thinking, yep, I see kids that are challenged with these types of things every day, either, you know, in your work life or your own kids or teammates of your own kids. My daughter is 12 and suffers from what I believe to be competition anxiety. She's a high honors student and a fantastic athlete. But when it's time to compete, she struggles with extreme anxiety, which is affecting her performance. She's expressed her frustration with this, and my wife and I encourage her to relax and just have fun, but it's not exactly working. And then I need some help with my 11-year-old son, who is a high-level athlete and recently had what appear to be anxiety or panic attacks. He's had a very tough year after significant health issues. Last week was very tough, and although he had a general psychologist currently, I am not sure he is the right fit. So I'm going to kind of move quickly through some of these mental toughness skills, focusing more on the building confidence and self-talk and the intensity control or stress management pieces. And we'll kind of see what time we have left. And of course, save time for questions as well. But again, just be thinking of this, happy to talk afterwards, but just be thinking of this as sort of tools in the toolbox for, you know, when you're traveling with your teams or you're working individually with student athletes in the training room, some ways that they can be spending their time. Or right now, you know, with everything being so crazy and feeling so out of control, many of them not being able to participate in their training, it's a great opportunity to spend their time doing some of these other pieces. So confidence. Again, if, you know, when talking to coaches and athletes about mental performance, confidence, I always say, is the foundation of the pyramid. So confidence is that true belief that an athlete has that they have what they need in the moment to overcome the task that's in front of them, right? So we use this picture a lot. What do you see when you look in the mirror, right? Do you see a kitten? Do you see a lion, right? And then we talk about the reasons for that, or where those feelings are coming from, and strategies to be able to shift that. So I always say that true confidence is not situational. And what that means is we're pulling from different areas, right, of, you know, what got us to this moment, depending on the task that's in front of us. But as you all well know, working in sports, that elite athletes, right, the high performing athletes, they figure out how to show up, right? Not perfect, but most of them are pretty excellent when it matters, right? And that's what separates them. So we talk about, you know, student athletes being able to sort of own that's their responsibility if they want to reach their goals, is to believe that that's possible, that they can kind of bring it every time. We want them to feel like their locus of control is something that they focus on as well. So regardless of the time of year, the weather, COVID, who you're competing against, how warm-up went, how the season's been going, where they've landed on the roster, playing time, all those things that, you know, they're doing their own work to have that unshakable belief in what they're capable of. So I get the question a lot on, you know, how do you work on this with an athlete, but also help them, you know, to be sensitive to the fact that you don't want to be overconfident, right? And most of the time athletes are underconfident, right? So, you know, we talk about still being coachable, right? Still having to receive feedback, but internally, right, that they're doing the work to believe in themselves. So when we talk about sort of building out a confidence profile, factors that influence confidence or that belief are past successes, physical and mental strengths and abilities, preparation, training, skill mastery, which obviously for many of them looks completely different right now. So, and their motivation to do these pieces also can look very different right now. So we're pulling from, you know, different areas in different ways, positive self-talk or the chatter inside their head. And then also feedback from others, which is a factor, but, you know, I always talk about that being kind of icing on the cake, because you can't depend on others to give you a certain type of feedback on a certain day. So we don't want to rely on that. We want them to be self-sufficient. So ways to sort of work on confidence with them, things that you can talk to your athletes about, guided journaling, which again, I'd be happy to share some more information and outlines about that, but giving them some direction and sort of framing out and shaping for them how to put down on paper what's going through their head. Over the course of a couple weeks, they developed a great self-awareness, which can create great conversation for you. From that, writing a confidence letter to themselves with affirming statements, which can be very uncomfortable for them if they're struggling with their confidence, but it's a goal based off of their journaling, can be really helpful and empowering. focusing on what you can control, which is huge right now. And many of you have probably been having these conversations, right, with your athletes or with your teams, with your coaches. You know, that's what we have. We have to be hopeful, right? So instilling hope that they still have things that they can control. It may look different, it may sound different, but list out and be very intentional and specific on what they can control, putting their energy into those things and letting go of the rest, which, you know, if all of us could learn to do that consistently, we'd be floating on a yacht somewhere, right? We'd be bazillionaires. That's just definitely a key, right, to success and overall well-being. So just challenging them to kind of focus on, you know, what's on their field, what's in their pool, what's in their court, and letting go of the rest. Self-talk is the most important piece of that confidence. So if there's anything you're going to have them focus on when they're journaling, it's really kind of charting out their self-talk. So oftentimes high achieving people, which many of us work with, high achieving people day in and day out, right? They are going to tend towards being more perfectionistic, right? Which can, you know, human response is to really think more on the negative, right? Or focus more on the negative feedback, holding ourselves accountable, which can really dip your confidence, right? It takes work. We're talking about confidence. That's really a state, but it's a skill to develop it into where it needs to be. So having them sort of flip the script in their head on their own self-talk, and this is a critical piece right now. They can be doing this at home. You know, get a baseline in their journal of what their self-talk sounds like right now, and let's flip the script so we're empowering our self-talk and being our best advocate rather than shutting ourselves down. So intensity control. So talking about, you know, managing their nerves, competition anxiety. This is, you know, a huge piece of the conversation, and whether it's, again, at the college level or, you know, youth athletes. So, you know, we want, again, to try and normalize it, that nerves are a good thing. Intensity tells the athlete that they care about the outcome, that they're invested. We want to reframe it as a positive. So we don't want them to feel like when they're getting ready to train or compete or, you know, do a fitness test or whatever's coming down the pike for them right now at this stage of the year, right? We don't want them to feel like that they have nothing going on that day and sort of like they're laying on the couch watching Netflix. Like, we want their energy to be in a different space. We just want it to be that controlled, good energy. So we talk about good stress or eustress, right? How that can help performance when it's at a certain point, and then being overstressed can, you know, burn energy and definitely shut them down. So many of you have probably seen this before. It's been around forever, right? But we talk about sort of this bell curve. We do this with teams a lot to help them get to know each other a little bit, and to talk about sort of putting an X on the curve where they think they perform at their best, and talking about what that feels like. So, you know, their stressors are they're presenting, right, cognitively, where their you know, thoughts might race, their thoughts might get really negative, they might catastrophize in their head, and they're also having a physical response, right? Many of them will get shaky, they'll have to run to the bathroom, you know, they feel like, you know, they're nauseous, they're sweating, any of those things. So getting them to have some conversation about, you know, what it feels like when they're nervous, and then talking about some ideas to control for it. So pre-competition routine is huge. These are all things, again, with some extra time right now, that might be good things to strategize about with them. Pre-competition routine, so they feel like they're in control of the process. Having an action plan for controlling their intensity, so that could be breathing exercises, it could be progressive relaxation. There's some amazing apps out there right now that are portable, you know, so that if they're on the bus or in the hotel or wherever they're trying to do this work, that, you know, no one around them has to know that it's happening. Again, identify controllables. And then gratitude is a huge piece. you know, again, having them feel like it's their decision to go out and compete and take this risk. They are taking a risk, but they get to do this. It's an opportunity. And having them work on what they're thankful for, you know, honoring their body and what it can do, right? And just sort of, again, grounding them with some different strategies to be able to have more control of their level of anxiety and nerves. We call it intensity control. It sounds better. So real quickly, I know I'm almost out of time here. Goal setting is a huge piece again right now, as far as being able to help them understand that, you know, this is a marathon, not a sprint right now. Reevaluating their goals, understanding the value in, you know, kind of the roadmap that they've set out to achieve. You know, helping them understand that, you know, it may be 1 step forward and 2 steps back right now, but they can individually be setting goals that are just really important to them. You know, so they feel like outside of what's happening with their team and with their sport and things that they can't control, they can still focus on their why and sort of what brings them joy in their sport, and put it down on paper. You know, have some achievement strategies for those goals. Focus on the process. The outcome may not be within reach right now because they may not be able to compete, but they can focus on their process and challenging themselves. And I have some goal sheets I would be happy to share if anyone is interested. So imagery, again, this is an excellent thing to utilize with athletes who are either dealing with acute or chronic injury, or if they're in the training room and you have 10 minutes to help them sort of learn how to do mental rehearsal. We know that imagery is a really powerful skill when it's done well. You may hear it called visualization or mental rehearsal. Creates that blueprint between the mind and body that when you mentally rehearse a situation or a skill over and over again, it lends itself to that performance happening physically. It's a great way to help with readiness, right? And their belief in their preparation. If they've been there 1,000 times in their head and they've seen a good outcome, it lends itself to them being more confident. We want them to use all their senses. So to teach them how to do imagery well, we want to just start with having them sit like we're all sitting in our chairs right now, and have them engage all their senses, have them talk you through, you know, what senses feel more vivid to them and what might not, including how their body feels in the moment. And then they can start slowly working towards seeing themselves in motion. The other thing is you can have them, you know, think about using both internal and external perspectives when they're doing imagery. So how do they naturally see themselves when they close their eyes and picture themselves going through a skill or going through a performance? So internal would be, you know, seeing themselves as if they're looking, you know, out their eyes, right? And then the external would be, let's say from the sidelines or where coach is standing, right? And being able to switch back and forth to be able to, you know, kind of use both to their advantage. The challenge with imagery can be that if you're not someone who's well versed in it, it can be challenging to avoid seeing mistakes happen. So that confidence, and we talked about that being the foundation, we really want that to be part of the conversation, because in order for it to help their confidence, you want them to be seeing good things happen. So you want them to be using imagery to reinforce kind of a highlight reel. And it can be really fun. Teams can do it together, or you can do it as a one-on-one. There's a question here. So focus and concentration, obviously, again, right now can look really different. One of the things that athletes have shared a lot over the past few months is that it really is difficult to sort of feel motivated and to focus on, you know, where they're supposed to be where their feet are, and be mindful and present. So just helping them to, again, create a baseline. on how this feels for them right now, and then to give them some skills to feel empowered about what they can be focusing on. So, you know, helping them know themselves better. So, you know, what is distracting for you? What does help you focus? You know, how can we talk about, you know, using that to your advantage so you can get the most out of the time that you are training, and help to develop their self-awareness. So just to wrap up, some of the, I guess, key questions around youth sport, which we know there's a lot of conversation on kind of the model of youth sport today and what direction we're going in. So for parents, how much support is too much support? How much helicoptering should they be doing? How much is healthy? Is my child college caliber? What do we do with this recruiting process? You know, understanding sort of where their child fits, and should I, you know, push towards Division 1, 2, or 3? They're not sure if they want to compete in college. How do we know what's the right fit? And also for youth athletes, how do I know if they should specialize or move up a level? And we all know, right, this could be a whole nother conversation as the area of, you know, sports specialization and early specialization. As a general rule, I'm always going to tell parents that the more that their athletes could be trying different sports and not specializing for as long as possible, in general, that's ideal. You know, sport by sport, that can present more challenges with some sports than others. So it just kind of depends, but, you know, just encouraging for all the reasons that they not specialize for as long as possible. And then a lot of conversations with coaches, athletic trainers, support staff. So for kids that, you know, don't seem to get it, you know, whether they're struggling to be leaders on the team, struggling with emotional maturity, team mentality, those types of things, or just are struggling with sort of that grit and resiliency that a lot of coaches look for, that can be missing sometimes in, you know, some of these kids that are coming up through, just strategizing on those things. How do I know how to manage the parents? Where's the line in the sand? And then who do I tell if I have a concern about an athlete, which I think Beth did a great job of covering. So at this point, I'm going to open it up for questions here. Hopefully I did okay on time.
That was perfect. Thank you very much. Again, anybody who's got questions, please put them into the Q&A or into the chat line there. And that was awesome.
Great. Could you hear my dog snoring?
Oh, yes. Yeah. And they had somebody had a dream and was like barking a little bit there.
They were also running in their sleep. So, hey, you know what? What can you do? Right? They're part of the family.
Here's a question that came up. If you had to write a research paper based on sports psychology and mental health, what population would you write about, and what intervention would you try with them? In other words, what areas of this field interest you and would be interested in looking further into? Phew, I can't read.
Yeah, no, that's a great question. I think that the need, right? So myself and sort of being, my heart being in this as, you know, my why as a practitioner, I think that the need right now is with our middle school and high school kids, you know, for the support around youth sport. So if I were going to dig in, just the confidence piece of it and what they bring to the table, and just as humans and where sport fits into that, and sort of helping them to be able to navigate their why and find sport for them in the way that brings them joy and brings them fun, right? And value, because for so many reasons, it's way out of sorts right now. So I think if I could really dig into a particular area where there's a need right now, and Project Play Western New York does a great job. There's a lot of research coming out of Aspen right now on those pieces of trying to figure out, how to balance that. And again, I have travel youth sport athletes. My kids are, in several sports, and there's tremendous things about that. And there's also some really unhealthy things too. So I would say that would probably be the piece that I'm most passionate about right now. Hopefully that answers the question.
There's a question in the chat. How do you approach situations where there are cultural obstacles that limit a student's ability to get the help that they need?
Yeah, I think that's a great question. And I think that just to be really candid with the group, I think that, especially in private practice, for someone like myself who does this kind of specialized work, it's similar to if an athlete is, in a situation where their family can invest in them having private coaching, right? Or specialized coaching in a particular area. That is not always the case for families to be able to have the resources to provide that. So, I would say again, kind of going back to what Beth shared a little bit about the school districts is, creatively problem solving to find a practitioner or professional that gets it, that is in their support network, right? That you can reach out to offer them support. Because I think that for sure, whether it's sport by sport, there are some sports that are more open to this type of work than others. I'm not sure when you're saying cultural obstacles, if we're touching on the right thing here. But I would say, from a financial standpoint, as well as the system standpoint, I think just finding your person that you trust that can, advocate for that child or be a point of contact.
Perfect. All right. So if anybody has any other questions for Kelly, just pop them into the chat or into the question box. And what we will do is move forward with the last speaker of the day. The last speaker is Dr. Dan Antonius, who started his education process in Norway and started collecting his degrees there and got his PhD from New School for Social Research in New York. Dan wears many hats, including a tenured associate professor at the Jacobs School of Medicine here at UB. He's the behavioral health specialist and team or psychology consultant for the Buffalo Bills. And he's the chief psychologist for the Erie County Forensics Mental Health and Counseling Services. So with that, Allison will cue up Dan and we'll be ready to go.
Thanks, Scott. I'm impressed you put in Norway there as well.
It was a very long CV that I had to go.
So everything actually started in Denmark. So when all of you hear my accent here, that's where it's from. Norway and Denmark. All right. So here I'm sharing my screen. And all right, final stretch, everybody. Hope you all had your coffee. And I promise I'm gonna mix it up a little bit here. I have a couple of scenarios. We're actually going to start with a scenario, trying to get everybody, wake everybody up here. And with that scenario, I'm also hoping that some of my panelists will chime in. And then I have a couple of videos that I'll show as well as we go along here. So again, Scott summarized well what I do. Part of what I do, I see athletes for mental health issues, and I consult with athletes and organizations as well. So it's a pleasure doing this here today. So my talk, the main thing I'm going to focus on today is really the return to sports. And this is whether you're an athlete, coach, trainer, parent, or other. And then the psychological implications of return to sports after this long period of isolation or not doing a whole lot, or at least not being with your teammates and other athletes. I'm hoping that this presentation will provide some or a better understanding of the emotional problems and mental health issues that athletes may encounter in their return to sports. And I put in there post-COVID, but honestly, it could also just be return to sports after an injury or after a long lag of time where somebody hasn't really been doing anything for whatever reason. And then lastly, we'll talk a little bit about the guidelines. Nikki talked a little bit about these as well. I'm going to lay them out a little bit more. And I'll also talk a little bit about local and national resources that are available for athletes with mental health concerns. Some of this will be a little overlapping from what Beth and Kelly talked about, but I still think it's good to kind of like go over it again. And I will talk briefly about the importance of having a plan. So if you see somebody with a mental health problem, whether you are a trainer or a coach or a parent, or whoever you are, and having, again, this plan of what you can do, a mental health plan, a mental health emergency plan, and the importance of that. So, like I mentioned, I have a couple of case studies, and what I would like to do is start with a case study to get everybody kind of like up to speed of what we're looking at here today. And then also discuss this case study a little bit, whether you raise your hand and Allison get you on, or you use the chat room or a question and answer, it doesn't really matter. But take a look at this case study and let me know what you think. So in this case, we have Sue. She is a 17-year-old elite swimmer at a local college. She holds several state and national records and is an integral part of the swim team. Her uncle, who lives in another state, recently passed away from COVID-19 related medical issues. Sue is concerned that she may contract the coronavirus through returning to school and participating in team activities, and unknowingly infect vulnerable family members at home. This is causing significant emotional distress and feelings of guilt that she's afraid of sharing with her teammates, in fear of being perceived as weak and the potential negative effects it may have on her team. However, on one particular tough day, she shares her feelings and story with her athletic trainer. So one of you, what should the athletic trainer do? And I'm going to help everybody out here. Here are a couple of scenarios. Just to get things started, the athletic trainer should tell Sue, A, to suck it up and understand that this is just the normal anxieties that all athletes go through, and that she'll be better off getting back to a stringent practice program. B, tell Sue to stop attending school and stop participating in sports, as her feelings are not normal. C, that there are resources available that she can implement into her training and preparations to better understand her experiences and what she can do to help herself. Or D, to see the team clinician or a psychologist so she can be evaluated for a psychiatric hospitalization. So, let's see if I can do this here. So we have one here, definitely want to listen to our concerns with patience and compassion, share resources available as coping mechanism to start. I like that one. Lots of C's here. So share resources. What about talking, if you have available a team clinician or a psychologist? What about any of my fellow panelists? What do you guys think?
I can jump in. This is Beth Botzer here, and I'm loving that you're all saying C. Great, because I think right off the bat, yep, you want to acknowledge that you understand where she's coming from. You don't want to jump the gun and automatically jump to, you know, thinking that she's not normal in any way. And I think the piece of, if you have the resources and you have counselors and psychologists at your disposal that can support, I mean, that would be fabulous. But I think in many cases, we don't have that luxury. So again, this is an elite swimmer. So, you know, ideally she might have more access to some resources. And if she has someone she can talk to about this, that would be wonderful. But in most cases, you know, in high schools and things like that, you're not always going to have that luxury.
Yeah, and I like that what some of you are saying here, that the D might be fine to see a team clinician or a psychologist if you leave out the psychiatric hospitalization piece. And I agree. I put that in there just to kind of like put it a little bit more pointed. But yeah, if you have available like a mental health expert, like a Beth or a Kelly with your team, that might be helpful. I don't know if any of our trainers on the panel here, what do you think you would say to a student or to an athlete that will come to you?
I would use my social distancing skills and call you Beth or Kelly.
Fair enough.
I also think, I'm going to chime in here, if you can hear me, I'm not sure, is like we often are talking to a lot of our athletes on a daily basis, and they unload on us all the time about this. So I think it is important that we recognize just now in the face of COVID-19 that this could be a little bit more serious, especially coming off such a long break and now you know, getting back into the swing of things, hopefully. But, you know, I think for us, it's sometimes navigating through the, you know, is this just someone who's over exaggerating, or is this a true fear and, you know, something that she needs to really talk to somebody else going forward?
I think that's a really important point, and also reflects that, you know, we're all part of the team. We're all part of this integrated team, and showing the support and maybe like looking for warning signs. You know, like, is this somebody who actually does need to see somebody, or is this somebody where, well, maybe the person just needs to talk to their coach, that the coach understands what you may be going through, and so on, and start there. But yeah, and that's kind of like my point, that the athletic trainer, you're all, whether you're a parent or a trainer or a coach or the athlete himself, you're all part of the same big integrated team. In this case, we all need to help each other. Okay, let's move on here. Click these out.
Can I chime in for 1 second too? This is Meryl.
Yes.
One other thing too that I've always found is, like, once we find out that it's not like a psychological thing, like maybe there's other teammates that have the same feelings. So kind of getting like a little group of like all the teammates together, and just have them kind of talk to each other about stuff and how they're feeling about the COVID.
Yeah, that's a great point. And again, you know, in a way, I mean, yes, some of us spend a lot of years like getting to become a psychologist and getting a degree, but we all have some of this in us. And you'll see this in one of my slides later on, that, you know, what can you do as someone, whether it's an athletic trainer or a coach or whoever, even like an equipment manager, what can you do when somebody comes to you? And it starts with being supportive and letting the person know that we're all in this together. We're all part of the same team. We're all struggling with the same problems to various degrees, but especially with something like COVID-19, we are all experiencing this at different levels. All right, let's move on. So I want to start with a little bit of background, and most of you know this already, but the COVID-19 pandemic for us in the US really started in March 2020, and it brought on an abrupt stop to sports participation. And not just sports, but work and school participation as well. Around this time, the Summer Olympics were postponed, the NCAA basketball tournament was canceled, the Major League Baseball suspended their spring training and postponed their season, and the NBA and the NHL suspended their seasons. Later on, as Kelly talked about as well, different college conferences, one by one, have suspended their fall athletic seasons, with the Ivy League and Big Ten and Pac-12 more recently, and as you just heard, all Division II and III conferences have suspended it, and we're just waiting to see what happens with the D1. The other thing I think is very important to remember is that within this time, around May, we also had widespread protest on racial and social injustice matters. There was a question earlier related to cultural differences. This, of course, had a huge impact on sport, with particularly professional and college sports, with many athletes taking a stand against social and racial injustice, and programs incorporating different ways to show their support for social justice. This also resulted in numerous athletes coming out with their own stories about injustice and the psychological implication that it had on them and how they cope with this. This talk, I'm not going to focus on the social injustice or social justice. I do want to say, though, that I do have resources for this if anybody's interested for their athletes or their staff about educational resources that can be built in. I'll be happy to share those. And those are resources that have been developed for sports organizations, and I've shared those with other coaches in the area before. Fast forward in the summer and fall, and now towards the fall here, we've had a return to sports, and it started with the low to moderate risk sports: golf, tennis, baseball, softball, basketball, and so on. I have two young kids that play tennis and baseball, among other things, and they've been competing now for the last month and a half, 2 months, in both tennis and baseball. So that's certainly ongoing. High-risk sports has also gradually started coming back, including football, dancing, wrestling, and so on. As you all know, the Major League Baseball, NBA, and NHL seasons have restarted. NBA and NHL are in the postseasons at this point, I believe. And we've had guidelines developed for how we return to sports. And these were discussed briefly earlier. I'm just kind of like re-summarize those again. And here are the general guidelines that have been developed, and they can typically be summarized into these 8 areas that if you're on a task force, you can consider these kind of like the gold standard. So one is the pre-participation physicals and daily screening that you implement into your return to sport protocol, daily screenings or periodical screenings of the athletes and staff to make sure that they don't have any COVID-19 symptoms. Social distancing, yes, Scott, always social distance when you can, 6 feet or 2 meters if you're in Europe. Sanitization, again, sanitize equipment, sanitize yourself as much as you can. Self-hygiene, washing your hands, having hand sanitizers available at your facilities, indoor or outdoor. Using personal protective equipment, masks whenever you can. Of course, you can't use this when, or the athletes can't use this when they're typically when they're practicing, but certainly before and after, and coaches and other staff can use it. Incorporate into your return to sports acclimatization phases. So different phases of how long it's going to take for you to get back into practice and competition. For college sports and professional sports, they've included a 2-week quarantine period as well. And this is not necessarily necessary for the community and youth sports where the kids are together every day anyway. Practice, what should practice look like with screening, group play, how many people in a group when they play together, and just numbers of people in general coming to practice. 7, having some guidelines around competition, what competition should look like. Again, with spectators, for example, or limited spectators, and also travel considerations. Are you using a chartered bus, chartered plane? Where do people sit in the plane or the bus? And then lastly, having an illness protocol. And I'm going to talk about that in a little bit, but having a protocol for how you bring back an athlete who actually had symptoms of COVID-19. At the bottom here, there are a couple of references. I should say this is a reference resource heavy presentation. So there are references throughout that you can use. I personally like the one from one of these from University of Pittsburgh Medical Center, where they divide their guidelines into youth sports, college sports, high school sports, and so on. The other one are guidelines developed by American Academy of Pediatrics. The CDC have also developed these very nice infographics, very colorful. You can put them on your walls, in your training room, wherever you want, easy to see, and they really touch on all the important things, including social distancing, sharing of equipment, personal protective equipment, travel, competition, and training, and so on. There's also on the right side here, there's a checklist for coaches, what they should be, what they should do or can do. And I like the second bullet point there, that coaches should be a role model. They should wear a clothed face cover and encourage parents, fans, officials, and sports staff to wear one during practices and games. The other thing that has been developed in terms of return to sports guidelines that may be helpful if you're part of a task force of putting these guidelines together, and it's these risk assessment tools. And this one is from the Aspen Institute of Project Play, where they divide activities in different sports into lowest risk, medium risk, and highest risk. This is an example from football, where again, you can see the low risk is training and engaging in fun activities alone or at home, whereas high risk is when you get out with your organized team and you use shared equipment. And if I click on the link here, you should also be able to, this takes you to their website, and you can see, scroll down a little bit here, that they developed these guidelines for a number of different fitness and fun activities, including up here bowling. You can see for bowling, if you're at home, doing things at home related to bowling, you're at low risk, versus high risk is when you go to the public alley and you participate in group play. And again, they really looked at pretty much every sport out there in terms of guidelines for what is considered low risk, medium risk, and high risk activities. The other thing that I mentioned earlier is about an illness protocol. So have some guidelines or guidance aimed for athletes with mild to moderate symptoms of COVID-19. I really like this infographic. This one is from the British Journal of Sports Medicine because it really divides it into these different stages that you should be looking at when an athlete's coming back. So stage 1 is really the first 10 days. This is when somebody is still symptomatic and where they are really engaging in almost no activities, maybe a little bit at home and some daily living stuff. And then after the 10 days, or after you're symptom-free, no more symptoms, then you move into stage 2 through 6, where you gradually kind of like get more and more engaged in activities. And then at stage 5, you resume normal training, and stage 6, you're back into competition. What I also really like about this model is that I don't know if it might be hard to see here, But at the bottom, on the monitoring, they also talk about psychological readiness. Is your athlete actually ready psychologically to go back to training? And we know that is a huge area of concern, whether or not somebody is actually ready to go back into full training and competition after a serious illness like COVID-19. And it's not just COVID-19, of course. We know that this could be a huge problem for athletes in general, also when they come back from serious injuries or other illnesses. So for the rest of my presentation here, I'm going to be focusing on the psychological impact of COVID-19. And questions that have come up is things like what mental and behavioral issues will we see from the long isolation and lack of athletic team participation? What avenues are the best to pursue to aid in getting help for the athlete? And I'm going to try to address some of those here. So I forget who mentioned this study earlier. Actually, I think this was you, Nicole. There was a huge study that was done by the NCAA in April and May of this year, where they surveyed almost 38,000 student athletes. And they asked them about mental health concerns during those months, April and May. And I'm going to take a little bit of time on going through these numbers because I think they're really, really important in terms of what your athletes or athletes in general were struggling with. So as you can see, this is gender stratified, so divided into male and female athletes. 50% of all female athletes and 31% of male athletes felt overwhelmed by all they had to do at this time. 42% and 31% experienced sleep difficulties. And as Kelly talked about, sleep difficulties can have a huge impact on athletes and performance. 39% of females and 26% of males felt mentally exhausted. 33% of females and 22% of males felt very lonely. 31% of females felt both a sense of loss and sad. And 27% of females and 14% of males felt overwhelming anxiety. And if you go further down, you can see that 16% of females and 11% felt hopeless, which is a big warning signs for more serious things. And if you go to the bottom, you can see that 9% of females and 7% of males felt so depressed that it was difficult to function. These are very, very high numbers. I should say, though, that they're actually slightly lower compared to what you found in the general population. So athletes are still doing a little bit better than what you saw in the general population, but still very concerning numbers. The other thing this study that I think is important for all of us to know is that they looked into barriers to training. So not surprisingly, that we saw a lot of high numbers in terms of these physical barriers, getting to a place, travel issues, getting into facilities because they were closed, use of equipment. So all these saw very high numbers of the survey participants saying that they agreed or strongly agreed that these were barriers. The other thing that we saw were these emotional barriers. So fear of exposure to COVID-19, again, being afraid that they were going to get it, lack of motivation to train, feeling too stressed or anxious to train. And then last but not least, felt too sad or depressed to train. So I'm going to try to keep up a little bit here with your questions and things as well as I can. I'm going to try to address most of the questions after the presentation, just so you know. So again, important thing here with this study is it really exemplifies how big of a problem the mental health, the psychological complications due to COVID-19 was among our college athletes. So there's actually another study that came out around the same time also looking at college athletes. It was a little bit of a smaller study, and it hasn't gotten the same press as the other one. And this was through the Center for Sports Psychology out of University of North Texas. And they looked at almost 6,000 student athletes. And again, what you can see here, there were very high numbers of clinical depression, clinical levels of, again, depression, with 1/4 of all females reporting depression and 16% of all males. The other thing that I thought was striking on this one was, again, sleep disturbances being relatively high, not as high as in the NCAA survey, but still high. And then risky drinking, substance abuse, being at 14% amongst men and 15% amongst women. And then last but not least, look at body dissatisfaction. During this time, I should say, this study again was done in April and May of this year, so during COVID. So during that time, they found in their student athletes that about 50% of all female athletes reported some type of body dissatisfaction. And amongst the males is about 1/3 of the population of participants that were surveyed. So again, very high numbers. The other thing that this study looked at that I thought was really interesting and telling was counseling. And what is really striking that in these months, post-COVID, only 2% of males and only 3% of females actually sought out counseling or engaged in counseling. So what that reflects, maybe it's partially that a lack of access to counseling, although we know that telehealth was widely available. The other thing that it probably does reflect is the stigma among athletes to actually seek out mental health treatment. But again, by the numbers that I just showed you before, the high rates of mental health issues, one would have maybe expected that these numbers of counseling, people going to counseling, should have been higher, but they were not. So just to summarize, what are some of the psychological characteristics that we saw, that we continue to see after COVID-19? One of the main things that certainly I've seen in my practice is the distress, the psychological distress caused by the long time of physical and emotional isolation. The other thing that's really huge that other people talked about before me as well is the confusion and uncertainty about the future. What is the future going to look like? Are they going to have a season? Are they not going to have a season? Are they going to train? And is this the new normal? Similarly for staff, what is the future going to look like for them? Insecurity about training and eating. I've heard that a lot actually, where how are other people training in this period? Are they training more? Are they training less? How they're dieting? What are other people doing? And again, then the stigma related to sharing of experiences, and then the high rates of psychiatric symptoms and disorders. And again, like that Beth was talking about earlier, high rates of depression and anxiety, and even like post-traumatic stress disorder. So I put in resilience at the bottom there. And again, this is not a psychological characteristic of COVID-19, but I put resilience in there because I think it's hugely important to remember that humans are very resilient. We are very good at adapting. And over time, things will get back to normal. And I think that's very important to remember. There's been a number of studies that have been done on different populations after catastrophes, so after natural catastrophes, earthquakes, and so on, and also terrorist attacks. And so there were some really interesting studies that came out after 9/11 in 2001, and the terrorist attacks at that time in the US, where they found that even though the psychiatric symptoms and psychiatric disorders in the time frame after 9/11 spiked up to 50 and 60% in the population, depending on where you lived and how close you were to the epicenter and the terrorist attacks. So 50 to 60%. Within 6 to 8 months, the population in general had gone, their symptoms of psychiatric disorders had gone back down to normal levels, so between 4 and 8%. So humans in general were able to adapt even to something as serious as a terrorist attack within 6 to 8 months, and they went back to normal. So this is meant to provide a little bit of hope within all of this, that we will return to normal. COVID-19 being a little bit different than a terrorist attack, I get that. But over time, through our resilience, we will return to normal. And we can all help with that, of course. So, what can we do? What can you do? What do you do when you have somebody that comes to you? So this is kind of like the question we had earlier. And I put up, first and foremost, be supportive. We're all in this together. Be a resource. Remind them to stay connected to other people. Reach out. Reach out to a clinician or a friend or whoever to get, again, to feel that you're connected. We're all in this together. We're all part of the integrated performance mental health management model. And this is really the holistic model that most of us strive towards. Holistic model of wellness and well-being. If you have a happy me, you have a happy family and a happy team, a happy staff, everybody's happy, the organization is happy, and it also results in better performance. The other thing that I like to do, and I told you I was going to share some resources here, and that is, and you can do this whether you're a parent, a trainer, a coach, share what you know, share educational resources, information. One that I really like is the NBA's website for Mind Health. This is very informative. I'm going to pull it up here. And here you see it. If you scroll down, there's a number of resources available for anybody on this website. I'm also going to show you this very brief video that they put together related to COVID-19.
Most of us are having to socially distance, don't socially isolate, really support each other during this time, because this time is tough.
Get outside, get some fresh air, alleviate the stress and the anxiety during this time.
So again, just an example of what they put together, the NBA, in terms of wellness resources. The NFL, they also have a very good website here that you can go to on their total wellness website, and it talks about the total wellness model and the holistic model that they use. And if you click on the resource tab here, they have a number of resources available, such as books, articles, and apps. I'm going to talk about some of these apps in just one second. The Major League Baseball, if you work with baseball players, they have a wellness website as well. This one is not as good as the other ones, I would say. But if you go to the Psych Hub, I'm not going to go here because they have a bunch of videos that will start automatically, but they do have a number of videos available related to mental health resources and mental health issues that you might come across in players. The other resource, I think, which is really good that I like to share with coaches in particular, is ESPN and their mental health awareness website. They have a number of articles developed by different players, professional athletes, and so on, where they talk about their mental health issues, their emotional problems, and so on. Kevin Love is always one of the ones that are highlighted there, and his struggles with anxiety and panic disorder and depression. And if we go to their website, I'm also going to show you a quick video that he put together with Rachel Nichols. Let's see if it comes up here. About COVID-19 and the importance of mental health.
You've been big on the fact that social distancing is not social isolation. What do you mean by that?
It's mean like we can't, it's so much of us and what we're able to do as athletes is reach people, but even on a personal level as well, just being able to reach out to your friends and feel that sense of community, and that this on the other side of this, we can come out changed. You know, I think the worst thing that could happen to us is if on the other side we don't do that. I get that feeling and get depressed when I think of the unknown. And so many of these people, like when I decided to help our arena workers, and these are people that we see every single day, and that's or 41 days out of the year when we play at home, that's part of such a bigger picture and a bigger community. And I feel like our relationships and our core competencies are things that we can definitely dive into. So for me, it's, you know, my, you know, relationship with my family, my friends, working on that, working on my body, and then, you know, just making sure I'm picking up, even if it's different hobbies or current hobbies that I'm into. So just really doing, you know, everything I can to stay engaged and keep my mind on top of things.
All right. The other resources that I find extremely helpful is apps. And I started implementing these more and more with the athletes that I see, because these are tools that you can have with you. You can use anytime. You put the app on your phone and you can pull it up at any time that you need to. You see here a couple of apps for stress management, and these are really meditation apps, mindfulness apps that you can use. I like Headspace. I'll talk about that in a second, but both Calm and Breathe to Relax are also like widely recommended for athletes. Some other apps that are recommended for athletes and people in general for mood boosting are Mood Coach and CBT Coach. These were developed by Veterans Affairs, the VA system actually, but they are meant for anybody. Mood Coach is meant to provide positive experiences throughout the day and help you actually having positive feelings and positive experiences. The CBTI is a sleep hygiene app meant to combat insomnia through using CBT or cognitive behavioral therapy techniques. In terms of Headspace, so what is Headspace? Headspace is an app. It's guided meditation for adults, kids, health professionals, educators, coaches, athletes, anybody, pretty much. The main idea is learn relaxation techniques. Learn how to relax. Why? Well, is to give yourself more space, mind space, head space, no pun intended here, more space for thinking and thoughts. And the idea is that you don't just go through the day and your stressful day without giving your stressors any thoughts. The problem is if you don't give yourself that time to think about your stressors, it actually just increases your anxiety, your worries, your stress. But by actually giving yourself a little bit of time to think about your stressors and actually think about them rationally, why you have them, that creates the space to lessen your anxiety. So that's the main idea, again, like behind this guided meditation. They're easy to use anywhere, anytime. And as you can see, Headspace has developed a partnership with NBA, MLS, and also the NFL. I'm going to show you a quick video here, the mind analogy. This is the hole in the road animated video. And think about this video when you go through your worries and you start developing more stress, maybe anxiety, or even depression, and how you kind of like, you dig yourself a hole and you just don't know how to get out of it.
Imagine you're walking down a street. It's a street you know well, maybe one you walk down every single day. But you're so caught up in your own thinking, wondering what you're going to have for lunch, thinking back to a conversation you had earlier, that you end up falling down a hole. Now at the bottom of this hole, you find yourself thinking, how did I end up here? Worse yet, the next day, you do the exact same thing. And then again, the next day. It may not sound like an especially cheerful idea, but as an analogy for the mind, it's really helpful. Because so often we follow the same habits of mind over and over again. And so we find ourselves in an emotional hole, maybe even a place that's really painful. But imagine if you started just noticing, being more aware of your surroundings. Sure, Maybe next time you'd realize a little too late and you'd still end up in the hole again. But maybe the time after that, you'd notice the hole and choose to walk around it instead. This is what it means to train the mind. This is what it means to have headspace.
So again, really therapy in a nutshell, and this is where meditation such as Headspace really can help. I also just want to show you Headspace for sports and the importance it can have for sports athletes in general, and not just now in terms of COVID-19. And this is the founder of Headspace who's talking a little bit about it.
I think for most athletes, there's always been the recognition that the mind's really important. You know, by the time you turn up at an event or a game or a race, you've done everything you can from a physical point of view. All that matters is where your mind is on that day. We actually started working with professional athletes probably about 5 years ago, before the very first Headspace app even came out, before it was launched. And I do think sport is just a great example of how we can cultivate and train the mind and then apply it to a very specific discipline in everyday life. There's something about kind of being present, being able to drop whatever's been going on in the past, being able to drop whatever concerns there might be about the race ahead, and actually just being present and applying the skill in the way that they've been trained to apply. First and foremost, we're human beings, and then we're athletes. And yes, that sport might mean the world to us, but the world is bigger than that. Once you look at the journey of sport and activity through that lens, it becomes very holistic. You know, we're not just focused on one thing, on the competition. It becomes a little bit about everything. Mind is mind, you know, and whether I turn up to a little fun run down the road or whether it's an Olympic race, actually kind of it still matters kind of in my training and in my competition where my mind is. When we apply ourselves to sports, to activities, we want to perform to the best of our ability, and part of that is not only making sure the body is willing and in shape, but also understanding the importance of the mind.
So again, if you haven't tried Headspace or one of these meditation apps, I highly recommend it. I use it. I think it's great. All right, more resources. So this has kind of like been alluded to earlier. Do you have a plan? What do you do when somebody comes to you with a mental health issue? And again, it could really be anybody, or it could be yourself. What do you do? Do you have a mental health emergency action plan? Do you have a mental health expert, somebody that is affiliated with your team or organization? If you don't have it, maybe see if you can find somebody. And the point here is to help develop a plan how to recognize emergent mental health warning signs in an athlete, coach, or other staff, and then knowing what to do. I'm just going to show up some examples here of warning signs and what we did with one organization, where we put together these kind of like spreadsheets where you can see on the left side, these are psychiatric disorders or concerns, and then on the right sides, warning signs that you might encounter. And then, you know, there's a whole plan of what to do next in case you see some of these warning signs. So for example, at the top, you have suicidality, and Beth talked about this earlier. And then if you go down, you have somebody displaying violent behavior or confusion or intoxication, and some of the warning signs that you might see. And at the bottom, there's psychosis. This goes on into domestic violence and warning signs, loss of a loved one, warning signs, trauma and the warning signs, pandemic outbreak, and social racial injustice. We also included based on what has been happening over the last 6 or 7 months. And the other thing that I think is helpful, and really truly in any organization that you might be involved in, even if it's a small grassroots organization, I think it's good to have some written policies and procedures around mental health concerns. And again, maybe develop some flow charts or have some infographics that you can use, that you can put on walls of what people can do, who people can call if you have a mental health emergency, or even a mental health non-emergency, like a non-threatening emotional disturbance. I also think a good thing could be to have a resource network. I put up there the reference to the NCAA Sports Science Institute that Kelly talked about earlier. They have some very nice mental health best practices. If I click on that here, you can see that it takes you straight into best practices. They even have a checklist here on their website for what you should be looking at in terms of mental health care and developing a plan. Scott earlier too should mention that he showed you a link to something very similar within New York State high school high school sports and their mental health toolkit. Here are some general numbers. Beth shared these with you before. If you don't have a resource network, but you need crisis intervention quickly, crisis services in Buffalo is probably the best one to call if it's immediate or emergent. But if you need information, you can also call the National Alliance of Mental Illness in Buffalo, or NAMI. They have a national helpline as well. You can also call Substance Abuse and Mental Health Services Administration, or their general helpline, or their suicide prevention hotline. So I'm looking at my time here. So now to break it up a little bit more, I have a couple more case studies. Are you all okay with those? Let's move to a case study number 2 here. So now you've been sitting here all day, and we're all soon fatigued here, but hopefully you develop some tools and some knowledge. So I'm going to give you a case study here of Drew. Drew is a basketball player. He comes to you and is clearly frustrated and angry. He reluctantly explains that he's upset that a number of his teammates and coaches are not following standard guidelines for safe practicing and playing basketball, and instead are mocking him. This has resulted in increased anxiety, fear of playing, and social isolation. He no longer feels he's part of the team, and he has become increasingly angry. What do you tell Drew? Whether you are an athletic trainer, a coach, a parent, what do you tell him? And I'll give you some examples again to kind of like get some discussion going. And my dear panel, let me know if you have comments here too. So what do we tell Drew? Don't worry, you'll probably not make the starting lineup anyway. Probably not the best. Encourage him to let others know about the blatant disregard for established guidelines. What do people think about that one? C, facilitate conversation about individual differences and that teammates often have different opinions about a variety of things. Due to obvious clinical concerns, recommend that he contacts a mental health expert to explore coping techniques. Everybody likes C. I want us to like rigged it here somehow. Combination of C and D. I like C. I think if we can start facilitate conversation, we're all part of this together, as I talked about earlier. I certainly like that. Any of my mental health experts want to chime in from the panel?
So I'm not a mental health expert, obviously, but I think this also plays into some family situations. You know, some family members are, you know, taking risks and doing different things, and others are very conservative, and it's not isolated to a team scenario. It has some stresses on individual families as well.
Yeah, I agree. I mean, we certainly see that those of us who are traveling around with our kids, that there are seemingly different guidelines wherever you go, and different guidelines from sport to sport.
Dan, this is Kelly. I like C as well, but I also think there's more of a conversation there about, you know, folks leading with their own behavior. You know, so if teammates aren't following guidelines, right? I think that's one thing. If also coaches aren't following the guidelines, that's maybe a bigger conversation. You know, because I think part of being, you know, on a team is shared values, right? And shared responsibility for the team's success. So I think, you know, C is definitely a great starting point, but also, yeah, we have individual differences, but we also should have a shared commitment here. You know, however that looks. So making sort of more of a discussion and sort of just honoring where the athlete is about it, and that, yeah, it is concerning, you know, and it's okay to expect more from the people you're supposed to be able to trust.
Yep. I'm just looking at the chat here. There's really good suggestions here, like somebody saying a multi-pronged approach, deal with his concerns on a personal level, providing support and understanding for his concerns on that level, provide resources, and also as an assistant athletic trainer, involve yourself in watching for those safety violations and address them from that as well. Another person here, I think if guidelines are not being followed, it's worth a discussion with the team. I think that's important. Who brings up that discussion? So another person, I would listen and try to calm the athlete, hear his concerns. I would facilitate a conversation, but between myself and the coach, initially because of COVID, there are safety protocols that must be followed. If coaches refuses to be compliant and cooperative, then speaking refuses to be compliant and cooperative, then speaking with the administration. And then another person here, I personally witnessed young athlete want to give up his sport presently due to concerns of causing the illness or death of an elderly family member. That's a really good one. That's a really big issue, and I think that's a big concern among some of our athletes, that they're going to contract the virus and give it to somebody else in their family. This is where I think if you start having a conversation about like what you can do, and in terms of what you can control, because at the end of the day, we can't completely eliminate the risk, but we can reduce it by following safety protocols. And I talk to a lot of my patients in general about that you know, they're concerned about like bringing COVID-19 home to their family, to a newborn, to a vulnerable family member. But talking to them about like, well, you know, you try your best by minimizing risk, by following the protocols. Unfortunately, you can only control yourself. You can't control other people. So starting to have that conversation with them. Beth, I didn't mean to cut you off. I saw you were on as well.
No. The only thing I would add, I agree. I totally agree with everything everyone is saying. The only piece is that if you know this Drew individual, and he is typically, you know, pretty low key kind of kid, and this is out of character for him, and you feel like, you know, there may be cases where everyone is following protocol and they're doing everything they possibly can, and there's going to be certain people that have this level of intensity to them that it's not enough, then they might be overreacting to, like it says that they're mocking him, you know, trying to get a take on whether or not that this is all really happening, and if this is something he's perceiving, and if this is out of character for someone. So again, Drew might be the type that generally likes to be vocal and complain about lots of things, and this is just something that as an organization are used to. But there's other situations where it might be out of character, and you might have to try to figure out what's going on in this situation. Just That's the only thing I'd want to add.
Absolutely. Okay, so last scenario, and then I'm done. Let's see. All right, so now we have a outbreak of positive COVID-19 test in a dorm, or it could also be a neighborhood. And in that dorm, which also houses several soccer players, turns out that 5 male soccer players test positive and have to be quarantined. One of the players has an underlying health condition and has to be hospitalized. This is causing concerns to not only the teammates, but also other athletes from other sports, and other players come to you and share their anxieties about being infected and having to be quarantined. On top of this, you are also experiencing your own anxiety related to the situation. What do you do? Let's give you a couple of choices here. Nothing. This is not my problem, and my own anxiety will pass. I'm going to call my psychologist due to my own worries and fears. C, call a meeting for all athletic staff to discuss the problem. And D, follow the plan and establish guidelines and notify relevant staff, coach, athletic director, GM, etc. D, let's see here. A lot of C's and D's. What about my panelists here? This is a really real example, right?
It is a real example, Dan. This is Nikki. I mean, going back to what I think something I pointed out in my presentation, if you heard, is like still remaining neutral and factual and trying to kind of diffuse the situation, not ignoring the fact that there is a concern that they need to be aware of, but, also, establishing that communication chain and making sure that these athletes and yourself and colleagues all have a place to go to talk about this and what the plan is, like you said, your response to illness earlier. And it not is just physical illness, but this, the mental side of this too, because clearly we are going to be encountering that this year.
Yeah, and related to that, one of the things that surprised me maybe the most working with different sports organizations, maybe I shouldn't be surprised, but it's not just athletes that come to us, it's assistant coaches, other staff, equipment managers. I mean, we're all dealing with stress, and during seasons, there can be a lot of stress. And right now, because of COVID, again, increased stress. So like some of you on the chat here are saying, definitely going to talk to my own provider as well. Self-care, yay, walk the walk, love it. And I see other people talking about that as well, if need be. And again, maybe one of these meditation apps will help. I'm telling you, when I used to play many decades ago, this was back in Norway. We had a sports psychologist named Willie Rilo. And he had developed some early meditation techniques. It's got to be like 30 years ago. And I remember reading the book and just completely buying into mindfulness. And now that we have these fancy apps available, I really recommend people to check it out. All right, I think I'm probably out of time here. Let's see.
Dan, there's one question in the Q&A. It says, any suggestion for free meditation apps? I know Calm and I think Headspace have limitations on their free content.
Yes, I don't know any completely free apps. I still use the free Headspace app. Maybe some of you, if you're affiliated with one of the larger organizations, they can buy a subscription for it. But I don't know, unfortunately, of any free ones.
There was another question that says, is there a good tool we can use to assess secondary school athletes' psychological readiness to return to sport?
Probably. I don't know, maybe, I don't know if Kelly or Beth knows one of these. I can tell you what I like to use. I have it's not a tool, but it's from research on return to sports after injuries. And I don't have that handy right here, but there are like 8 or 9 domains that I always tap into. Biggest one being fear, being afraid, being worried about returning, because we know that is a huge risk factor for re-injury. So, and I see here, this is related to subscription. Thank you, Michelle. She's saying it might be worth asking if they have any other subscription services such as Peloton, because sometimes meditation is built into those types of apps. I know for me, Peloton has meditations, and if you already pay for it, they're quite good. Yeah, and actually related to that, I know with some of the sports organizations, we also used, it's like a free yoga website that also has meditation built into it. Just came to mind. All right, thank you, everybody.
All right, well, thank you. That was awesome. Oops, what do I got to do here? Okay. So I'd like to thank everybody for participating today. Again, special thanks to all the panelists. It's a difficult topic and something that as athletic trainers we don't often think about, but I think that you all did a great job interacting and communicating a difficult time for us. So again, some procedural things. We're going to be sending out a survey and a quiz through your registration email. Please fill that out quickly and get it back to us. Once we get it back, we'll email you your certificate of attendance and the PDFs of the presentations. Lastly, as I mentioned earlier, we start the process for our symposium, probably November, and we're always looking for new topics to explore. If you have any ideas or anything you would like us to explore in 2021, please forward that to me in your survey, and we'll look into it. Again, thank you for attending. Thank you, Allison, for keeping us all out of trouble for the most part. And we look forward to seeing you when sport returns. Thank you, everyone.